Okay. As far as monitoring of Sophia, would you agree that weekly or even biweekly weight check-ins is appropriate for her?
Yes.
And is that something that a parent could do at home, weigh their child at home?
I suppose they could. That would not be the standard of care in these cases. These cases, children are typically taken to a medical facility for weight so that we can weigh on the same scale in the same manner every time to document consistent weight gain.
Okay. So if the parents were willing to take Sophia for weekly check-ins with their PCP, would that be appropriate?
It would be appropriate, yes.
And the same way the parents were following the supplementation of the goat milk formula that resulted in weight gain, if they were to follow whatever feeding formula that the child is in currently, do you expect that Sophia will continue to have positive results?
I would expect that, yes.
I pass the witness.
Thank you, Ms. Lucero.
Thank you, Your Honor. Dr. Hanson, my name is Wayne Lucero. I represent Sophia. I just have a few follow-up. As far as there's been testimony quite a bit about refeeding syndrome, so that is no longer an issue. Is that correct?
That is correct.
All right. And then there'd been testimony earlier that Sophia had been started on goat milk and she'd gained a pound or around a pound in, I guess, maybe a 2-week period. Is that right?
Yes, I think a pound, about a pound in, yes, about 2.5 weeks.
All right, then. Could you agree with me that if she, that goat milk was working for her and it'd been 2.5 weeks, she gained a pound, that at least the parents, were moving forward on the right path following the doctor's recommendation?
I think they were following some of the recommendations, but there were certainly other recommendations that were not followed.
Now, I'm just specifically talking about the supplementation. As far as the concern was weight gain, things like that. And I understand, that they didn't agree to the blood work. I'm just talking about there's issues about her weight. She started gaining weight. There's a plan in place with goat milk. And so would it have been, could the child just continue to have been monitored at that point just to, make sure that she was continuing to gain weight with the supplementation?
I think she could have been, although she did not follow up with the PCP for those weekly weight checks as they were at least as the doctor documented the plan.
Okay. Now, as far as Ms. Whittington asked you, if you'd ever spoken with the parents and if you were aware that the father specifically wanted to speak with you, did the department ever advise you that the dad was kind of concerned about all these medical procedures, things like that, and he'd like to speak to you directly? They didn't share that with you?
I was not aware that he had asked to speak with me. And to be honest, I don't have, at that point, I had never seen her. I had only reviewed records. And so it would not be standard practice for a doctor to reach out in that way because he had treating physicians that could answer his questions. So my response would have been refer him back to his treating physicians.
All right, then. And so even if he would have reached out to you, you would have been able to speak with him, or you probably wouldn't have spoken with him. Is that what you're saying? I just want to be clear.
If he had called and told me who he was, then I would have answered questions and things like that. But I would not have been able to initiate that contact. Does that make sense?
I understand. So the what you had was whatever the department told you the parents were not doing, also the medical records that were provided to you, and that's kind of how you made your, I'm not going to say recommendation, but your decision that, hey, this child needs to go to the hospital. Is that right?
That is right.
Okay. Now, when you reviewed the medical records from, I guess, the Coon Memorial Hospital out of Dalhart, I believe, did anywhere in those records where the parents had taken the child and there had been weight gain issues, was there anything in there that recommended that she needed to be hospitalized?
I did not see recommendation for hospitalization.
Okay. Now, you had stated earlier that the placement is currently feeding her on a schedule. She has a schedule, and also on feeding cues, I guess, kind of old school. Whenever like the child looks hungry or is fussy, they try to, to see if maybe she's hungry. Is that what you mean by feeding cues?
Yes, they feed her when she's hungry. She's not on in a set like every 3 hours or every 4 hours. They feed her when she's hungry.
Okay. Well, in any of those records that you reviewed from prior medical providers, did you see where it was mentioned that the mother was also feeding her based on feeding cues? Did you see that?
Yes,
Okay.
yes.
Now, whenever some parent or some moms, I guess, when they're breastfeeding, and they're not pumping, but they're just straight breastfeeding, would you agree with me that they're really there's not a way to show exactly how much the child is getting, how much breast milk the child is getting?
Sure, that's correct.
Okay. So when they start breastfeeding and then the child falls asleep and seems like they're satisfied, some parents would believe, hey, she fed well and she went to sleep.
Sure.
Okay. Now, would some of your concerns be alleviated as far as the child being placed back with parents if there was a court order in place that they follow the feeding plan, that if blood work is required, they take the child to follow up on blood work to make sure things are going accordingly, and also weekly weight checks? Would that help alleviate your concerns?
It would, my concerns would be alleviated if her feeding plan was being followed and she was showing up for medical care and following the recommendations from medical providers. That's all that I recommend for her now.
Right. Okay. I'll pass the witness, Your Honor.
All right, thank you. Ms. Ferguson, any follow-ups?
Just really briefly, Dr. Hansen, how often or how common would it be for the department to ask you to talk directly to a parent?
For a child that I'm not seeing in clinic, it's not typical. That's not how things usually happen.
And is that why the recommendation was to take the child to a pediatric specialist so that they could then ask their questions to the specialist who saw the child?
Correct. And someone who is experienced in malnutrition in children could make appropriate recommendations for her health.
Do you believe, after reading the medical records that you've read, and your assessment on this case, that it would have been reasonable for the parents to believe that their child was eating enough?
No. And based on the photos that I saw of her at that time, I don't think anyone would reasonably believe that this child was getting enough nutrition.
Thank you, Your Honor. I pass the witness.
All right, Ms. Whittington, any follow-ups?
Yes, Judge. Dr. Hansen, since Sophia was seen by other medical providers even up to the day before she was admitted to the hospital, and none of those providers recommended hospitalization, would you think that would be strange for these parents, that someone that hasn't seen the child would recommend hospitalization?
Sure, I can see that would be an unusual occurrence, I guess. Yeah.
No further questions, Judge.
All right, Ms. Lucero?
Nothing further, Your Honor.
All right.
Your Honor, I do have one.
All
I have
right.
a follow-up. Dr. Hansen, why do you believe that the medical provider that the parents saw on the 14th and the 10th, why do you believe that medical provider recommended lab work?
To assess her underlying nutritional status.
And if that lab work came back, well, okay, can lab work show refeeding syndrome? What kind of things does it, and what do you look for when you're looking for that?
So again, we look for different electrolytes and chemicals in the blood. We look for iron levels and anemia levels and things like that.
So if they had gone to the lab work and gotten the lab work back, would it have made you more comfortable that the child was okay and didn't necessarily need hospitalization had the lab work been done?
It might have, yes.
Okay, thank you. Your Honor, I pass the witness.
All right, anyone else?
No questions, Judge.
Dr. Hanson, what was inappropriate about the parents providing pureed food when it was recommended that they supplement the nutrition otherwise?
Sure. So infant purees are typically fruits or vegetables that are blended down and then mixed with water. And so they have less calories in them than regular milk or regular formula. And so they make babies feel full because they fill up their tummy, but they're filling up their bellies with essentially water. And so it has very little nutritional value. And on top of that, based on Sophia's age, she's not developmentally ready yet for baby foods. And even on the baby food containers that you buy at the store, it tells you this baby should be able to sit up by herself and hold her head up before you feed her baby food, which Sophia could not do.
Okay. So in the records you reviewed, no medical provider suggested pureed food. Is that correct?
That is correct.
Okay. Did you recommend, when you reviewed the records, did you recommend that Sophia be immediately taken to the hospital?
I said she needed to go to a hospital where there were pediatricians to be evaluated.
Okay. And there may not be an answer to this, but in cases of failure to thrive or malnourishment for a baby this age, are there any recommended services or classes that can help teach parents how to provide adequate nutrition?
I mean, I think parenting classes typically cover like normal feeding for infants and sort of how feeding changes with the baby's development changes. Um, Speech therapists and occupational therapists provide a lot of education to caregivers around baby feeding also, but beyond that, I'm not sure.
Okay. All right. Thank you. Anyone else have further questions for Dr. Hanson? All right, then, Dr. Hanson, I'll go ahead and remove you so you can go about your afternoon's business. Thank you for your testimony.
Thank you.
Good to see you again. Okay, we're going to take about a 10-minute break.
Okay, good. Ms. Ortiz, please state and spell your name for the record.
Maddie Ortiz, Mattiortiz.
And how are you employed?
I'm a speech therapist at Northwest Texas Hospital.
And what does a speech therapist do?
We work on feeding, swallowing, and speech and language and cognition for all ages, birth to death.
And while she was at the hospital a few days ago, did you see Sophia Quicksell?
I did.
And what type of evaluation did you do with Sophia?
I was called to do what's called a bedside swallow evaluation, just looking at her oral motor skills in her mouth and seeing how she was feeding and the efficiency of that.
And what did you find?
I found that her skills for bottle feeding were adequate for what they needed to be at the time for the specific bottle that the parents had brought.
And did you interact with her parents?
I did.
And how was that interaction?
Can you be more specific?
Okay, yeah, absolutely. Were they receptive to the info? Okay, let me just back up. Did you provide them with information?
Yeah, I provided them with some suggestions and just kind of a background of what was going on. I think there was a lot of confusion in the beginning of why all this was happening. And so I just wanted to take the time because I had the time to educate them on the severity of the situation and why kind of everyone was really concerned. And go ahead.
Oh, sorry. How long had Sophia been in the hospital at that point?
I believe she'd been admitted the night before and I was there in the morning, I believe.
And did you talk to them about why her feedings needed to increase?
Yeah, so mom had told me that she was feeding 8 to 10 times a day, which should be plenty. But I guess the quality of those feeds wasn't enough to sustain her. And so um, my job was kind of just to see if there was anything like in her mouth or swallowing that was causing the lack of weight gain.
And did you make a recommendation for the amount of time that the feeding needed to happen?
Yes, so specifically for bottle feeding, all types of bottle feeding, we want to keep it 30 minutes or less, just because if we go past that 30-minute mark, when we start to burn more calories than we're taking in, which is just not going to help. And I educated the parents on that multiple times.
And why did you have to educate them on that multiple times?
Um, well, the first time I educated them, and then the next day, the nurse had said that they were kind of taking the bottle, and reintroducing it over the 3 hour in between time between feedings. So I just wanted to re-educate again, make sure they understood the why behind that 30 minutes, because I don't know if I explained that the best the first time. And so explaining the why behind why we want to keep it to 30 minutes or less. Provided that education probably 3 times with them.
But you did tell them exactly to keep it to 30 minutes. Is that correct?
That is correct.
And even after the first and second time you told them, they continued to feed for 3 hours. Is that correct?
Um,
Check, Judge, unless Maddie was in the room for that full 3 hours, she would have no personal knowledge if that's true or false.
Did you review the records, Ms. Ortiz?
so
Or
I
was it, let me just ask you, did you review the records to determine that, or did one of the nurses just tell you that?
one of the nurses said the next time that she had walked in, they
Okay.
were still trying to
Okay.
feed the bottle, and it had
Okay.
been like
Okay. Okay. Sustained.
So, um, so on the second time that you discussed with the parents about why it's necessary to feed for 30 minutes, how did they react?
I believe they were receptive. The second time, because they hadn't been following, I decided that we would have either a nurse or a like nurse clerk in the room to monitor to make sure that was happening. One of the times that I was feeding, I just took the bottle out with me to report to the nurse how much she had taken, and then we removed the rest of the formula that was in the bottle.
Okay. And so was that the intervention that you had to do, was removing the bottle from the room to prevent them from feeding for more than 30 minutes?
On my one time that I was there, yes, and I recommended that they would have someone in the room with them because I understand the pressure of trying to feed the baby.
Yeah. Um, did how did the parents react just overall to the information that you provided them?
Um, they would they were receptive to it. I felt like sometimes they would ask questions. Um, there was one interaction that I was confused by the response to. But I feel like when I was talking with them in person, they were receptive. But then I think sometimes my recommendations, they weren't, like specifically with the feeding tube, they weren't really for that. But we tried to get a different plan to see if that would work first.
Okay, and so let me ask you that. Was there, you mentioned a feeding tube. Was there a recommendation at some point for a feeding tube?
There was, it's an option that we have. I kind of explained to the parents why we would do that is because she's not going to be burning any calories. It's all nutrition. It wouldn't develop. What I was worried about is any type of bottle aversion. So she was going from not eating a lot to eating a significant amount. And so I was worried if we're almost having to force feed that much, that she'll develop an aversion and then we'll have to get a feeding tube anyway. And then it's just a lot harder once that aversion develops. So that was my recommendation. But the parents didn't feel comfortable with the feeding tube.
And I mean, did they ask you any questions about the feeding tube, or what was their response when you recommended a feeding tube?
Yeah, I mean, I think a feeding tube to any parent is really scary. It seems pretty drastic. As a clinician, it's something that's very normal to me. We do it with most of our NICU babies, and lots of babies who are in PICU and things. So, to me, it's kind of desensitized. And so I think I can understand how it would be scary. But in my brain, the scientific brain, I know that there's very, very, very little to no risk for the feeding tube and more risk for the bottle feeding.
And did you explain to them that the risk to baby Sophia for not eating would be greater than the risk of the feeding tube?
Yeah, and I will say I started the conversation about the feeding tube before it was 100% our last option. So
Okay.
there were still a few other things that we could try that the parents decided to go with. And then I had educated if these options don't work, then we will have to do the feeding tube. And they ended up working.
Okay. Um, so in your evaluation, I think you noted that there were great oral motor skills. Is that correct?
Mhm.
And that goes along with what you said that she was taking the bottle really well. Is that correct?
That is correct.
Um, what given that she had good motor skills, um, did you talk to the parents about why you believed that she might not be eating enough?
Um, I mentioned a few things that could be going on. I mean, there's a million different things that could have been happening. Specifically from my expertise, it could have been either that we weren't producing enough breast milk to could sustain her growing, um, or for some reason she was just not an efficient feeder on the breast, and that was making her burn a lot of calories. I don't know necessarily why.
So why is it important to feed her over a 30-minute period versus a 3-hour period?
Kind of like I'd mentioned before, when we go past 30 minutes, their body, it's like running on a treadmill for them, really, really a lot of work. It's the hardest thing they do. And so after that point, they're starting to burn more calories than they're taking in.
Okay. And did you describe it to the parents just like that?
I don't know if I used the treadmill analogy. I definitely could have. I used that one quite a bit, but I did explain the burning more calories than we're taking in quite a bit.
And do you feel like the first and second time you explained it that they understood that?
I think that's hard to tell. They could have understood it and not agreed with it. That's possible. They could have not understood it. I don't really know the answer to that. Their faces look like they did, but I don't know how.
Um, so and did they ask you any questions that would indicate whether or not they understood it?
Mm, I really do believe that they mentioned things, but to be honest, I cannot remember.
Okay, sure, that's fair. Do you did they have any resistance to the amount that baby Sophia needed to be fed?
Yeah, I think they were concerned with the volume. They talked a lot about how her stomach has been eating only a little bit for a long time, and so I remember them like looking up the size of her stomach and trying to figure out how much volume would fit into her stomach. And so I think that was a concern for them, thinking that it's a lot of volume for a stomach size.
And did you talk to them about why you wouldn't necessarily, or did you tell them that they should wait on Sophia's hunger cues, or did you tell them that they should go ahead and focus on the amount?
Yeah, so typically I explained typically with a regular developing baby, yes, we can pay attention to her hunger cues. However, we've been doing this with her and obviously it's not working. So at this time, we cannot listen to her hunger cues because we're at a scary point in her weight gain. Um, which is another reason why I hate when a baby is like pushing the bottle out to keep reintroducing it because it causes bottle aversions and things, which is why my first recommendation was a feeding tube because they were not having that aversion develop.
Okay. And overall, would you say that you had overall, would you say that the amount of education that you had to provide to these parents, how does that differ from other parents that you've interacted with?
Mm. Um, I feel like I do give a lot of education with all my parents, whether that's asked for or not, just because I feel like it could be helpful. I would say probably on the more and like repeating myself more frequently, than most patients, but I don't know if necessarily, yeah, I don't really know the answer to that.
How unusual is it for parents to not follow your recommendations when you recommend that they only feed for 30 minutes?
Mm. I would say that 30-minute mark is a hard thing for a lot of parents. Especially when there's pressure of like, well, she has to drink all of this volume and what's 5 more minutes, like what's 5 more minutes? She
Uh,
has to drink all this volume. I think that pressure can be scary as a parent, especially like a mom with feeding. That's the number one thing that you do. And so I think that can be a lot of pressure. I would say it's pretty common, to be honest, for parents to go past 30 minutes.
How often do you see a child that is as malnourished as Sophia was?
That was my first time.
Thank you. Your Honor, I pass the witness.
Thank you, Ms. Whittington.
Thank you, Judge. Ms. Ortiz, my name is Mary Whittington. I'm an attorney and I represent the parents. We appreciate your time today. So during Sophia's hospital stay, how many times would you say that you visited with the parents and Sophia?
I believe 4 or 5. I think it's in my record of how many notes I was with them. However many notes I have is how many times I was with them. But 4 or 5, I think.
Okay. And how long were those interactions?
Anywhere from 5 minutes to 45-ish minutes, somewhere around there.
Okay, good. And during that time, did you have an opportunity to observe the parents and how they interacted with their daughter?
Mhm.
And did you have any concerns with that interaction as far as their attentiveness or showing of love?
No, not any problems with the way that they showed love.
Um, so part of your meeting with them was to provide education, is that right?
Correct.
And did you leave them with any documentation that they could read later?
I don't know the answer to that question. I don't know if I did.
Do you have documentation available that you could leave with parents in the situation where they need more education?
I do, yeah.
Did Sophia?
Oh, go ahead.
Go ahead. No, you go ahead.
I was saying I usually have a form that I send with parents before discharge. It is hard to tell when they are going to discharge. And so that doesn't always happen. I don't believe that I left them with all my recommendations on paper.
Okay. Now you talked about bottle aversion. Did Sophia ever develop bottle aversion?
I don't believe she did.
Do you recall finding that mom was quite attentive to Sophia?
I do.
And did you have any concerns at all as far as whether or not these parents were deliberately withholding food from Sophia?
I did not.
Now, mom, you mentioned that mom said she fed the baby 8 to 10 times a day, but for about 5 minutes per feeding.
Mm-hmm.
Did Sophia ever develop bottle aversion? Do you feel like that's part of the problem with Sophia's weight gain? It just wasn't long enough?
It could have been, mom had expressed how she would usually fall asleep at around the 5 minute mark. So that could have been part of the issue. But I believe she was seeing a lactation, was seeing lactation support before.
Did you observe mom or dad or both feeding the baby whenever you visited with the parents in the hospital?
I did.
And were they doing the feeding appropriately, holding her head, holding the bottle? Any concerns at all?
Not with the feeding, no.
All right, I pass the witness.
All right, thank you, Ms. Lucero.
Thank you, Your Honor. Ms. Ortiz, you stated that when you first met with the parents, that you kind of talked to them for a while because there was some confusion. Can you elaborate on that, what the confusion was or what was going on?
Yes, so I think in my brain they just didn't seem like they were understanding the severity of the situation. So I wanted to explain, like Dad had mentioned, he was like they sent police officers to take our baby away, like take it because we didn't take them to the hospital. And so I just kind of wanted to take the time to explain, like, as an infant, her brain is growing and developing so significantly. It's requiring lots of nutrition. It's not like adults where if we go a little bit without nutrition, we just lose weight. Her brain could be affected, could cause lifelong deficits like cognitive deficits, not being able to walk. I wanted to be pretty explicit because when I first started, Dad was like, well, like I'm skinny, she could be skinnier or have like a smaller head. And I was like, okay, we're not understanding this. I want to explain, like, no, she could have permanent brain death because of this. Like, I don't want that.
Okay.
And I think that was the only interaction when Dad responded with like, okay, well, we're here now, that I was like confused. The reaction was a little bit confusing to me. I was expecting just more severe of a reaction, not like necessarily that they had to cry or anything, but like a oh my gosh kind of realization moment. That was the only confusing interaction.
I understand. But then again, would you agree with me that parents react differently? You deal with parents all the time. Parents react differently to the same information. Would you agree with me?
They do have different reactions.
Okay.
You're
Okay. Now, as far as you stated that you saw her, you saw Sophia about 4 or 5 times, anywhere from 5 minutes to 45 minutes while she was in the hospital, right?
correct.
And were you feeding her each time? Were you just observing, or what were you doing? Let's say for those 45 minutes that you were in there, what would you do?
Yeah, so sometimes I would feed just to see how things are going. I think the first couple of times I fed, but then I think it's really important that I watch parents feed, coach them through it, teach them, make sure they're doing it because they're the ones who's going to be doing it most
I
often.
understand.
And so some things there's only things I can see when I'm feeding. So I like to feed a few times, but then also allow parents. So it's both.
Okay. Good. And so whenever you stated at one point, you fed her and you took the bottle out to report how much she had eaten. Do you recall how much she ate during that time that you took the bottle out during that feeding?
Yeah, that was our first feeding that I was concerned about. This number might not be correct, but I think it was like 35, it was 30 or 35 milliliters.
Okay.
She needed to be like 120 or something. And so that was the first feeding that I was like, oh, this is not looking good.
Okay. And you were the one feeding her at that time, or was it the mother?
That's a good question. If you guys have access to my notes, you definitely can look and
Okay.
see. I'll report it who is feeding.
Okay. So let me ask you this. If why did the feeding stop? Why did she only feed that much? She just fell asleep, or what happened there?
No, is that 30-minute mark?
The 30-minute mark? Okay. All right then. Did she doze off? Do you recall what she was eating? No, that's all she ate during that time. Okay.
Mhm.
All right. Now, you stated earlier that you understand the pressure that parents are under, especially moms, when they're trying to feed the baby. Is that right?
Yeah.
Okay. Would you agree with me that it's possible that if, you know, the baby's not gaining enough weight, and if they didn't have the proper education prior to this, that they just think the longer I feed her, the more she's going to eat and she's going to gain weight? Does that kind of follow maybe what a parent could possibly be thinking?
Yeah, I think so. That's why it's important that there's healthcare and doctor visits to educate.
Okay. And were you aware that these parents are first-time parents?
Yes, I did know
Okay,
that.
okay.
About other children.
And so maybe they needed to learn and maybe have some further education.
That's definitely possible.
Okay. Yeah.
And Your Honor, I guess I'm late, but I was going to object. That's facts, not in evidence as to first-time parents.
Overrule.
Now, you stated that they were pretty uncomfortable with the feeding tube. Is that right?
With the feeding tube?
Yes.
Mhm.
But you also stated that that's like a last option, right? You know, y'all try different options and then usually, well, not necessarily the last option, but if there's something else that can be done and a parent says, hey, let's try this instead, maybe that's a possibility in what happened here, right?
Yeah, that is what happened. Yeah.
Okay,
It's
okay.
not usually my last. It's usually
Okay.
when I'm being top one. Yeah.
Okay, and so so it did work. So it didn't get to the point that she needed a feeding tube. Is that right?
In the hospital, correct.
Okay. Now, while during your care and everyone that was helping with Sophia, was there concern about refeeding syndrome?
A feeding syndrome?
Refeeding syndrome, like she hadn't eaten a whole lot and then she starts eating a lot, and that they're concerned about that issue. Did anybody ever talk about that with you, I should say?
Like physicians or anything had
Yes,
not.
yes.
No, they had
Okay.
not talked with me about that.
Okay, okay. So at that point, when you were helping the parents, you know, helping them or watching them, feed Sophia, was there a goal as to how much she should be feeding during those 30 minutes?
Yeah, there was. Yeah.
Okay, and what was the goal? I mean, what's the standard goal, I guess I should say?
Well, it's a different goal for every single baby. They do
Okay.
it. I don't know that side of things. That's more of the dietitian side, but they do a calculation based on weight and things like that.
Okay,
Um, yeah, I don't know. I
okay,
don't remember actually the exact amount, but
okay,
we were working with a dietitian to try to see if we could do more frequent feeds with less volume, so she could still meet that.
okay. And then you stated that you didn't give them any kind of written recommendations, at because you're not sure when she was going to get discharged, things like that. But in a child that's been diagnosed failure to thrive, do you have like just basic recommendations that you make from your end?
No, I would not say there's just a basic set of information. I would say it
Okay.
changes based on each child's
Okay.
need.
What would have been your recommendations for Sophia?
For feeding overall,
Yes, yes. After, upon discharge.
um, I just what she was safe on, the volume that was working in the hospital, I would have recommended that upon discharge.
Okay.
The regular bottle of the Avent, I think it was a level 3 that they were using with the volume range every 2 hours, I think is what before they discharged what they were on.
Okay. And then that bottle that she was using at the hospital, was that something that was provided, I apologize, provided by Northwest, or was that something that the parents had brought?
That was something that the parents had brought from home.
Okay. All right. Thank you. I'll pass the witness.
All right, Ms. Ferguson, any further questions?
No, Your Honor, and I would ask that this witness be excused.
All right, Ms. Whittington, any further questions?
Do you have just a couple, Judge? The bottle that the parents brought from home, was that appropriate then for hospital use?
Are you asking me that question?
Oh, yes, sorry.
No, you're okay. Yeah, if parents bring bottles from home, we like to work with what parents have at home because that's the most functional, to make sure it's safe for them in the hospital.
Okay, very good. And just your observations of Sophia overall, besides her weight, was she alert and interactive and smiling?
Mhm.
And did she seem to know who her parents were?
Yes.
Okay. All right. No further questions, Judge.
Ms. Placero, anything further?
Nothing further, Your Honor.
All right. Okay, Ms. Ortiz, thank you for your testimony. I'll remove you so you can go about your afternoon's business.
Thank you.
Thank you. All right, Ms. Ferguson, next witness.
Veronica Prosser, if she's still in the waiting room.
Well, I have Allison Palmer, Caroline McBride, and then I have someone on the phone line. We can check and see if that could possibly be her. We need to know anyway, so let's get the phone
Okay.
line. All right, this is Judge Graham. I've let someone in on the Sophia Quickle hearing on a phone line ending in 977. If you would unmute and identify yourself, please. On the phone, you can hit *6 to unmute.
My name is Veronica Prosser, social worker.
Okay, thank you, ma'am. You're right. You're who we were looking for. So, ma'am, if you'd raise your right hand, you swear the testimony you give will be the truth, the whole truth, and nothing but the truth.
I do.
All right, thank you. Ms. Ferguson?
Ms. Prosser, can you state and spell your name for the record?
It's Veronica Prosser, Veronica, and then P as in Paul, RO, S as in Sam, ER.
And how are you employed?
I'm a licensed master social worker at Northwest Texas Hospital.
And did you have did you interact with the parents of Sophia Quickle while she was in the hospital?
I had an interaction with mom.
And can you describe what happened?
I was able to interview mom. Sorry, I'm going to get out of the wind. I was able to interview mom the day after she was admitted. And I just did a basic assessment that I do with all of our patients.
Judge, I'm having a hard time hearing her.
I am too. I don't know, Ms. Prosser, if you, it sounds like you're moving around. I don't know if that's it or you need to get closer to your phone, but we can barely hear you and there's a lot of background noise.
Sorry, I just got in my car. Is that better?
That's
Yes.
much better.
Okay.
Thank you. Ms. Prosser, so can you just describe your interaction with with the mom?
Yes, I did a basic assessment, so we just kind of find out who lives in the home. Does patient have a primary care physician, pharmacy that they use? So mom was able to answer my questions. It was a very simple, easy conversation.
Were you involved at all in discussing the issues surrounding a feeding tube?
I was not. I was informed of the discussion. I was not
Okay.
there for the discussion.
Okay. Did you discuss it all with the family? Well, how did the family seem to you when you interacted with them in the hospital? Were they compliant with all the recommendations?
I wasn't there like when they were talked to about recommendations. My interaction with mom was, like I said, a very simple conversation. Mom had a flat affect when I was asking questions. No smiles, but she answered all the questions that I did ask her. Baby was in the room as well, very calm, made no noises.
Okay. As the hospital social worker, what is your overall job?
So my job is basically to do psychosocial assessments. Again, just finding out basic information. So if a patient were to need something when they leave, a family doesn't have it, I would be the person that could order it or help facilitate it. And I'm able to give my information to the physicians that we do have a doctor, we don't have a pharmacy, those type of things.
Okay. And is it also part of your job as a social worker to get involved if any type of social services need to be sought for a family?
Yes.
And does that include any type of interaction with the Department of Family and Protective Services?
It does.
Okay. And were you aware of the situation that brought Sophia into the hospital?
I was, yes.
And so is it fair to say you had reviewed the documentation regarding that?
I was informed by the department that family was coming in and we were going to evaluate for failure to thrive. That's what I was informed of.
Okay. And when was that?
So I spoke to the family on 4/23. I received the call on 4/22.
Okay.
So the day they were admitted, I had already been informed that they were coming to the hospital.
Okay. And was that to help facilitate a smooth transition when they got to the hospital?
Yes, just to make sure our physicians were aware that we were going to be getting a patient.
Okay. And in your basic assessment of the family and also in your review of the records, did you have any concerns with this family?
Like I said, my concern, I guess, again, was mom's flat affect. There was no smiling, just very blank. Mom answered my questions, but again, a lot of times when you're interacting with people, you get a smile, you get a cringe. Sometimes I've physically watched body actions, and there really weren't any.
And as a social worker, what does that mean to you?
To me, what I'm looking for is, are there concerns on the family's part? Is there nervousness? Like I said, I didn't appear to see any nervousness. And again, very flat. So again, when I don't see smiles, it worries me just because I don't know what the family is like outside of the hospital. Since I had no interaction before, I don't know if that's mom's normal way of interacting. I'm unsure of that.
Okay. And so the fact that you're noting it today, does that mean that stood out to you versus other families that you met with?
That's usually one of the first things that I recall is how did the conversation go, and again, the interaction with the family is what I typically remember the most.
Okay. And did you feel like that she understood the gravity of her daughter's situation?
I'm unsure on that, honestly.
Okay. Okay. Thank you. Your Honor, I pass the witness.
All right, Ms. Whittington.
Thank you, Judge. Ms. Prosser, you wouldn't necessarily expect a parent to be joyous or smiling overly if their child is being admitted into the hospital, would you?
No, but typically
Thank you.
you
No, no
see
further
some type
questions,
of,
Judge.
sorry.
I'll pass the witness.
Ms. Lucero, questions?
Thank you, Your Honor. Yes, ma'am, you stated that the department reached out to you on April the 22nd of 2026 to advise you that a child Sophia would be probably being brought to the hospital or admitted to the hospital. Is that right?
Yes.
Okay. And then what day was Sophia actually admitted?
She was admitted that night.
Okay. So she was admitted the night of the 22nd?
Yes.
Did you have any interactions or conversations with the department regarding that they were going to seek a court order to have her admitted, or did they share any information about her being brought to the hospital? Who would be bringing her?
I'm unaware of who for sure was going to be bringing her. I just know that there was an order for her to come to the hospital.
Right then. And again, I'm sorry to harp on this, but the conversation was on the 22nd. Is that right?
Yes.
Okay. I'll pass the witness.
All right. Anyone have further questions? No? Okay, then. Ms. Prosser, I'll go ahead and remove you so you can go about your afternoon's business. We appreciate your time today.
All right. Thank you.
Thank you. All right. Ms. Ferguson.
Your Honor, I would call Carolyn McBride.
Okay. Ms. McBride, this is Judge Graham. If you'd unmute. Thank you, ma'am. If you'd raise your right hand. Do you swear the testimony you give will be the truth, the whole truth, and nothing but the truth?
Yes.
Thank you. Ms. Ferguson.
Ms. McBride, will you just state and spell your name for the record?
Caroline McBride, CarolineMcBryde.
Thank you.
Yes, ma'am.
When was the first time you saw Sophia Quickle?
I saw her first on April 10th.
Okay. And was that the first time your clinic had also seen her?
No, she was being seen by a certified nurse midwife. She was delivered at the hospital in Dalhart.
Okay. And do you know after she was delivered if she had any follow-up care?
She did. I believe she was seen up to around 2 weeks.
And that would be the first newborn checkup, is that correct?
I believe she had 2. I think she had 2 visits with Jamie after being discharged.
Okay.
I'm
And
not
so
wrong.
what was Jamie the midwife?
Mhm.
Okay.
Yes.
And was there a letter on March 30th written to the parents that asked for them to allow Jamie to set up visits, further follow-up?
I don't know what date, but I do believe they were trying to get the patient seen for the 2-month visit.
And when do patients normally get seen for the 2-month visit?
At 2 months old.
Okay. And so so is it standard protocol that at 4 months, if they've missed the 2 months visit, that that your clinic would reach out?
I'm not sure. I've spoken with Jamie, and she stated that the parents were not sure if they were going to continue care in Dalhart or go in their hometown of Stratford. So she wasn't sure if they were going to be seen with us or if they were going to go elsewhere. So I don't know the following of that from the clinic. That wouldn't have come from me.
Okay. Okay. So on April 10th, they did come in to see you. Is that correct?
Yes, ma'am.
And what type of visit was that?
I was notified from Jamie that the baby was being seen. Well, the mother was being seen by Jamie for breastfeeding concerns. And she called me and was concerned with the baby's weight and asked if I would see the patient.
And were you concerned with the baby's weight when you saw her?
Yes, most definitely.
And so what type of evaluation did you do in regards to that?
So
Can I interrupt for just a second? Ms. McBride, what do you do for a living?
Oh, I'm so sorry, Judge. I didn't have lunch, Judge Graham. I'm sorry.
I'm a PA, a physician assistant.
Okay, thank you. Sorry to interrupt.
And let me just get some biographical information out of the way. So you're a physician's assistant. What does that do? What do you do as a physician's assistant?
So we are able to treat, diagnose patients under the supervising of a physician, similar to a nurse practitioner.
Okay. And what hospital did you work for, or clinic?
I work for Dalham-Hartley County's hospital district. I work at the High Country Rural Health Clinic there.
Okay. Thank you. So when you first saw baby Sophia, what did you recommend?
I was immediately concerned. So we went through feedings, what baby was consuming, and then discussed that we needed to increase that significantly through either starting with breast milk and then supplementing with formula as well. We discussed both options, and then getting lab work as well.
And what type of formula did you recommend?
We discussed a handful. I remember parents were concerned with cow's milk formulas, so we had discussed goat's milk's formulas to trial. I think we talked about Kindamil, maybe Cabrita.
Okay. At that point on April 10th, did you recommend any formula?
Yes, I did. Mm-hmm.
And what was it?
Well, I just formula in general, whichever one they would be willing to do.
Okay. Okay.
Yeah.
So your records show that you noted that there was a failure to thrive. So what was it that made you believe that baby Sophia had a failure to thrive.
Her weight would be the failure to thrive.
And do you recall what her weight was on April 10th?
It was around 7 pounds, I believe. I don't know exactly from the records. I could look.
If I told you 7 pounds and 3 ounces, would that sound right to you?
It sounds right, yeah.
And are you aware of what her birth weight was?
Yes, it was 7 pounds and I believe 1 ounce, I believe.
So what does that tell you when she's only 2 ounces more than her birth weight at 4 months?
That she has failure to thrive. Most commonly, failure to thrive can be from either not consuming enough, burning too much calories, maybe a genetic metabolic condition. There's lots of causes to it. So it doesn't tell me everything. It tells me that there's something we need to figure out.
And so what did you recommend? Did you recommend any tests to try to figure what was going on?
Yes, I know she didn't have her second newborn screening done, so I had ordered that, CBC, CMP, and a TSH for thyroid.
Okay. So you said CBC, and what was the next one?
CMP, metabolic panel, and then
TMP. Okay. Okay.
and then TSH is thyroid stimulating hormone.
Okay. And so what were you looking for with all those tests?
Just a baseline of her general health, and then the newborn screening could tell us if there is any metabolic condition that could be the cause of it. So based off speaking with the parents, it seemed like it was very likely inadequate intake that was the cause of it, but we needed to investigate further and make sure nothing else was causing it.
And did they go in for any of that testing?
No, they did not.
Did they tell you that they were going to?
I don't know if they explicitly said that they were going to. I'm not sure.
Did you express to them how important it was to get those tests done?
Yes, I did.
Can you recall the gist of what you told them?
I know that they had hesitancy of doing any lab work, and I understood that. It's not fun to see your baby go get labs drawn. I said that it's very, very likely that this is all just a feeding issue we need to figure out, but we do need to investigate and make sure that there's nothing that we are missing. So I know I said something along the lines of that.
Okay.
Mhm.
And did you also recommend a follow-up?
Yes, so they had an appointment on the 14th to establish care with me. So that was already a set appointment. And then the 10th appointment just came about because of concerns of weight.
Okay.
So I knew we were going to see each other in 4 days.
I apologize. I didn't hear what you said that last part. After the 14th was set, and I didn't hear the last part. I apologize.
The 14th was an appointment that was set to establish care. So that appointment was already made in advance. The 10th visit came about because of concerns from Jamie. And so I knew I was going to see them in 4 days.
So even though you had an appointment on the 14th, is it fair to say Jamie's concerns were so great that you fit them in even sooner than that?
Yes, I think the following Monday or Tuesday would have been good to assess how the weekend have gone. So I do think it was a good timeline that was already set.
Did you, in your notes, you note that you talked to them about malnutrition. What did you tell them about malnutrition for Sophia?
Well, I told them to kind of grasp the gravity of it, that Sophia, in theory, should be double her birth weight. So a healthy baby would be about 14 pounds. So I do think me telling them that was a big communicator of where we're at with baby's health right in this moment.
How did they react to that?
I think they were surprised by that. I mean, I think they could tell that she was a little bit underweight, but I think saying that she is should be 14 pounds was a little bit surprising to them.
Did you tell them, in your notes it says that you talked to them about emergency department precautions that you discussed with them? What precautions did you talk to them about?
So baby in clinic was very alert, active. She wasn't lethargic. I believe I don't know if she ate in clinic on Friday, but she definitely ate in clinic on that Tuesday I saw her. So I discussed like no limited feedings, no urinary output, lethargic baby. Those are really red flag signs that we need to go to the emergency department to be evaluated for.
Did you recommend an amount of time? Did you recommend weight checks?
Yes, I did tell them I believe I told them on Friday that we would be seeing them very frequently to monitor this.
And so on the 14th, is that when they came in on the pre-established visit, but also for a weight check?
Yes. Mhm.
Okay. And what is a weight check?
So it's just to see that baby's weight is going up at a steady rate. We don't want to see it dipping down. It's just to check their weight, to monitor it.
And was Sophia's weight coming up?
I do believe it went up a little bit on the second visit. I couldn't tell you exactly. I can look. She was 7 pounds 5 ounces on the 14th. So it did go up. Mm-hmm.
Okay. And on the 14th, did they tell you that they had started using formula?
No, they had not started yet.
And were they supplementing with something else?
They were just doing breast, and then they had started doing purees as well.
And were you concerned at all about the purees?
Yes, I was. Mm-hmm.
And what was your concern there?
I generally, that's what I'm trying to say, don't recommend any purees until baby's 6 months old, and that's at a healthy weight. So a 4-month-old who is underweight can become a choking hazard, and it's just not needed for nutrients at that point.
And did they tell you why they had started doing purees instead of your recommendation for formula?
No, they did not. I do not know.
Okay. Did you tell them to stop with the purees?
Yes, I did.
Okay. On the 14th, did you ask them again to go for lab work?
Yes, I did. Mm-hmm.
And what was their reaction on the 14th?
They seemed that I felt that they would get it done on the 14th. Yes.
And did they?
No, they did not.
Did you make a recommendation on the 14th specifically for formula?
Yes, I believe so.
Okay. And did you also note that the baby had motor development delay?
Mm-hmm. Yes.
And what does that mean?
So motor development, I remember when we laid baby tummy down on the table, she was not able to lift her head up. And so musculature wasn't very strong yet. Most 4 months old are able to lift their head up, put their arms on the table and kind of push up too. So she was behind on her development with that.
And did you, in your visit with them, did you have any theories as to why she might be delayed there?
Well, very likely her weight would be the factor in that. Mm-hmm.
And did you discuss that with the parents?
I believe so, yes.
Are you aware of whether or not the parents went to the laboratory to do the tests that you recommended?
Yes, so I did speak with the lab, and they said that they did go over there, but they declined once they saw it was going to be like a needle stick in the baby.
Okay. And did you make another appointment for a weight check at that time on the 14th?
Well, I didn't make it. I usually tell my patients as they're leaving to speak with the receptionist and make a 1-week follow-up. So I did tell them I needed to see them weekly. So within a week.
And did they make a follow-up appointment?
No, ma'am, they did not.
And did that concern you?
Yes, it did.
And why?
Well, this is just a baby who's significantly underweight, needs to be monitored very frequently. So it was worrisome that she may not be seen in a week or two to me.
And did you feel like there was a risk to Sophia if she wasn't seen on a regular basis?
Yes, I did.
And did you communicate that to the parents?
Yes, I did.
And exactly what did you tell them, if you can remember?
I remember talking to them about how significant of a situation this is, and if we didn't get this taken care of effectively, it would lead to having to be in the hospital or something of the sort. So I know I laid out very bluntly to them that this was something we needed to treat as quickly as we could because we're already 4 months in and we need to take care of it.
Were you concerned at all about refeeding syndrome?
Not necessarily at that point, no.
Okay. And when would you have become concerned about that?
If she started having symptoms to be concerned with it.
And what symptoms?
So, I mean, reflux, significant reflux, bloating, not wanting to eat. So, I mean, symptoms like that.
And what would you do if she was having those symptoms?
It would just depend on the severity of it.
Is that one of the things that you look at with blood work?
It can be a factor, yes. Mm-hmm.
And how many children with refeeding syndrome have you encountered?
None. I have had none.
Okay. Thank you, Your Honor. I pass the witness at this time.
Ms. Whittington?
Thank you, Judge. Ms. McBride, my name is Mary Whittington. I'm an attorney and I represent the parents. Thank you for your time today and thank you for waiting on us.
Yes, ma'am.
So I just have a few questions as I feel like we've asked all of what we can. My main thing is on the appointment on the 14th, is it fair to say that's when you really had some very specific conversations with the parents about formula? Did you give them a list?
Yes,
to look
I believe I wrote on a sticky note because they were wanting to look into goat milk specifically. So I believe I wrote down maybe 3 different names of formulas that we could trial, whatever was convenient and available to them to do.
Okay. And on the 14th, you said there wasn't another appointment scheduled. Did anybody from your office reach out to them about scheduling an appointment?
I'm not sure if they did, no ma'am.
Okay. And did you recommend that Sophia be hospitalized?
Not at that time, no ma'am.
Did you ever make a recommendation to these parents that Sophia should be hospitalized?
No, I did not.
All right. While the parents were visiting with you, did you note that they reacted or interacted, I should say, with their child appropriately?
Yes, they did.
And were they respectful to you as well?
Yes, they were.
I pass the witness, Judge.
Thank you, Ms. Lucero.
Thank you. Ms. McBride, you stated that when you saw Sophia on April the 10th, that that she was alert and active. She wasn't lethargic. Is that correct?
Yes, ma'am.
Okay. Now, being that she was underweight, if you would have seen her like just lethargic and just kind of not reacting at all, would that have caused you even more concern for her health?
Yes.
Now, I understand that with the purees, y'all recommend maybe you stated 6 months. Is that right?
Yes, ma'am.
Okay. All right then. And so, but even those from the 10th until when you saw him again 4 days later, she had gained just a bit of weight in 4 days, right?
Correct. Mm-hmm.
Okay. So, would it seem that maybe just from that weight gain in 4 days that the parents were working towards, fixing the issues with her weight?
I think they were more aware of it, so they were more cognizant of how much milk she was eating per feeding.
Now, I understand that they didn't go follow up with the lab work and things like that. But as far as again with her being alert and active and not lethargic, as far as the lab work, what would it? I'm sorry, and I know that Ms. Ferguson asked you, just to be clear, what would that have shown you? The lab work that you were recommending.
So the CBC is for blood counts, so that can show if there's signs of infection, if she's anemic, and then the CMP is metabolic, so kidney, liver, and electrolytes. So electrolytes could be helpful to determine if she's dehydrated, something of that nature. And then the thyroid is to determine if there's any thyroid disorders that's going on.
Okay. Now, if a baby's dehydrated, things like that, will there be a decrease in the wet diapers?
Yes.
Okay. And did the parents report to you that she was requiring diaper changes? She had wet diapers? Okay.
Yes, she was.
Okay. And then when you examined her, I know there were questions about refeeding syndrome. You stated from a visual, I guess, when you examined a child, you'd mentioned bloating and reflux, things like that kind of tips you towards possible refeeding syndrome. Is that correct?
Mm-hmm.
Okay, but you didn't see any of that when you saw Sophia on the 14th?
No, ma'am.
Okay. And as far as like motor development delay, that could just I understand that she's underweight and that could have been an issue, but do some children have issues and need ECI type help even when they're not underweight?
That can happen, yes.
I'll pass the witness.
Ms. Ferguson, any follow-ups?
No further questions, Your Honor.
All right, Ms. Whittington?
No questions, Judge. Thank you.
Okay. All right. Thank you, ma'am. I will go ahead and release you so you can go about your day's business. Thank you for your testimony. And again, I'm sorry you had to wait so long in the waiting room.
No problem. Thank you so much.
Thank you. All right, Ms. Ferguson, do you have any other witnesses?
Your Honor, I guess Allison Palmer.
Okay. Palmer, this is Judge Graham. If you'd unmute, please.
Hello.
Hi, thank you, ma'am. If you would, please raise your right hand. You swear the testimony you give will be the truth, the whole truth, and nothing but the truth.
Yes, sir.
All right, thank you. Ms. Ferguson?
Thank you, Your Honor. Ms. Palmer, will you please state and spell your name?
Yes, it is Allison Palmer, ALLISON PALMER.
And how are you employed?
I am a family nurse practitioner at the Stratford Family Medical Clinic.
And did you, on or about April 21st, did you evaluate Sophia Quickle?
Yes.
And what did she come in to see you for?
She came in as a work-in. She was not originally on our schedule that day, but I was contacted by Haley Wagner, who's associated with CPS, asking for a second opinion well child check. That was honestly the first time that I've ever had a second opinion well child check. So we were able to work her in and get her seen and evaluated in the office.
And can you recall approximately what her weight was when you saw her?
She was, I believe, right at 8 pounds.
Okay. And did you have any concerns when you evaluated her?
The obvious concern was, yes, for how underweight she was. She did not fall anywhere on the growth chart. She was in the 0 percentile for weight, and then she was in the 15th percentile, I believe, for her length.
Okay. And you also note that you had concerns for gross motor skills. Is that correct?
Yes. So whenever we put her on the schedule, we just decided to treat it as a well child exam. And so whenever we do a well child exam, there's something called an ASQ, which is it's a questionnaire that's filled out by the parents. They are standard for 2-month, 4-month, all the way up until I think the kids are about 4. And so basically what it does is it goes through several different categories: communication, fine motor skills, gross motor skills, personal social skills. And so Sophia scored intermediately, like of concern in gross motor.
And so what can you tell me, can you tell us what specifically made you flag that she had gross motor skill issues?
So just based on the responses that the parents had answered on the question, and then also your gross motor skills are your big movements. So that's going to be obviously the lifting of the head, the fact that she can't push up if she's on her tummy. Whereas your fine motor skills are the smaller things like that. I also, because I didn't know the baby, we did try to contact Caroline's office to kind of get a little bit of a backstory. And she was out of the office. And so I didn't know any of the backstory other than what the parents were giving me that day. But I did note that I kind of just, put my pinky finger in Sophia's mouth to kind of see what her sucking reflex was. And I didn't feel like it was that I could strongly and conclusively say that she had a strong sucking reflex. I didn't feel comfortable with that, with, determining like, yes, that is the absolute cause or not cause. So I did talk to the parents about, I do think that you should seek out a speech evaluation evaluation so that you can, rule that out as a possible cause.
Okay. And
well,
so I'm sorry.
I didn't get the ending of her answer. I'm sorry.
Sorry.
Oh, just that I did talk to the parents about following up with Caroline to do a speech evaluation if that hadn't already been done, for them to refer her to speech therapy.
And would that be ECI?
Yes, it would. Yes.
Okay. Okay. Did you also recommend that they use any particular formula?
I did. So whenever I talked to the parents, they told me that they had just started with formula feeding the week before. They had gone through Similac and Enfamil, and they felt like Sophia had some reflux issues with that, which is not uncommon. And so they went to the Cabrita, or the goat's milk. So I came back to my office and did some research on high calorie feedings. And so my recommendation was, until they could get back in with Caroline, to try Nutramigen with a high calorie prescription. So I wrote it on a prescription for them to shoot for 22 kilocalories per ounce, I think. And so I wrote it out 2.5 scoops per this amount of water, and recommended that they feed her every 2 to 3 hours. No more than 3.
Okay. Were you concerned at all about refeeding syndrome?
I was not at the time. I have no labs. There was no obvious fluid retention. There was no abdominal distension. So no, I was not concerned for that.
Were you concerned at all if they started the Nutramigen and she started to gain weight, that could be an issue?
No.
Okay. Are you aware that she was hospitalized the next day?
Yes, I was.
And you mentioned that you didn't have any labs for evaluating the refeeding syndrome. Is that important?
Yes, I would say that it is important, but again, she came to me as a second opinion on whether or not I felt like this baby was in immediate danger. And I did not feel like she was in an immediate danger. I felt like the parents needed strong education, close monitoring, and reinforcement.
Okay. And have you ever treated a baby with refeeding syndrome?
No.
Your Honor, I pass the witness.
All right, thank you, Ms. Whittington.
Thank you, Judge. Ms. Palmer, my name is Mary Whittington. I'm an attorney and I represent the parents of Sophia. Thank you so much for being with us today and thank you for waiting for us. So, Ms. Palmer, you mentioned the baby weighed 8 pounds whenever you first saw her on the 21st. Is that right?
Yes.
And did you say that you did get the records from Carolyn McBride's office?
I think that we did get them. Yes.
Have you had a chance to look at them?
No, ma'am, I have not.
Okay. Do you recall at the time of your visit that you noted that the child had no apparent distress?
Yes. So whenever I said she had no apparent distress, she was not crying. The baby was on the breast the majority of the time. Mom had baby on the breast. She was not feeding. It was more of a comfort, is what it appeared to be. But whenever I later on the exam table for the physical exam, she was not irritable. She was awake and alert and responded appropriately.
Good, that's great. And the parents, how would you describe their interaction with each other and the baby?
I think that they interacted appropriately with each other based on what I saw in the exam room. Dad spent the majority of the exam, he was working on filling out paperwork for us because she was a new patient and there's a lot of information to be filled out. But whenever I asked questions to each parent, they each responded for themselves, and I didn't see anything that was concerning.
Okay. In your examination of Sophia, did you notice any physical indicators of abuse, such as bruising, cuts, unexplained injuries on the child?
I did not.
Okay. And you did not recommend hospitalization, correct?
No, I did not.
Okay. Are you taking new patients?
Yes.
If the parents were to bring Sophia to you as a new patient, would you be able to accept her as a new patient?
So in family practice, we have training in a nurse practitioner program to be able to care for healthy infants and then across the lifespan. So if there's anything of concern, whether it be feeding issues, thyroid disease, anything that's out of a routine well child, I would refer them and have referred them in the past to a pediatrician because I feel like that is out of my scope and it's not appropriate for me to provide care to a child who has something abnormal going on.
Okay, but once Sophia is at a healthy weight, she would qualify then to be seen in your office regularly?
As long as she didn't have any other metabolic or hormonal disorders.
Okay. After you evaluated Sophia and visited with the parents, did you speak to the CPS investigator?
Yes, I did.
And do you recall your conversation with the investigator as far as education that the parents might need?
I told her that it was my recommendation that based on my one interaction in the office today, that the parents seemed like they genuinely cared, they had taken within the time that they had seen the last, that they had seen Caroline in her office to the time that they saw me on the 21st, they had started formula feeding per what they told me. Whenever we talked about why they declined blood work, Dad did mention that he felt like possibly CPS had been called because he refused the blood work. He said, I took my wife to the doctor and they had trouble getting her blood and she was all bruised up. Why would I don't want to do that to my baby? So I had that conversation with Haley as well. I said, I don't think that they are intentionally being neglectful. I don't think they're doing it to be harmful. I think that they need a lot of education and I think that they need a lot of reinforcement. I would definitely recommend some parenting classes to be able to help better educate them and support them, and close follow-ups with Caroline as their primary care provider, and just close monitoring in that aspect.
Okay. Did you feel like, or would you feel like removal of this child from her parents? Do you think that
Your Honor, I'm going to object. That caused for speculation.
I didn't hear the whole question, but I know where she was going. I'll sustain that objection.
All right. I tried. I'll pass the witness. Thank you, Judge. I'll pass the witness.
You get an A for effort. Okay. All right, Ms. Lucero.
Thank you, Your Honor. Ms. Palmer, as whenever you examined Sophia, you stated that the parents were cooperative. She was underweight, but she was alert, things like that. Is that correct?
Yes, ma'am.
Okay. And then whenever did they advise you, or could you tell from were you aware whether or not, since Sophia had seen Miss McBride, whether or not she gained any weight in that week or so?
No, I don't recall.
All right then. Now, whenever Haley Wagner, I believe you said it was, that reached out to you from the department asking you for a second opinion, what was it? Second opinion for what exactly?
Just that there had been a call made to CPS by the primary care provider, and that they were just looking for a second opinion, just that.
Okay. All right then. And then whenever you shared, and I won't go over all of it, but you presented it to the court today, everything that you advised Ms. Wagner, that you didn't believe the parents were doing this on purpose, that they just needed more education, reinforcement, things like that. How was her response to that? Did she agree with you, or do you recall?
I think that she was agreeable to the fact that I was giving a recommendation.
Okay. All right then. And you stated earlier that you didn't feel that Sophia was in immediate danger. Is that what you stated earlier today?
Yes.
Okay. Did you share that comment or that statement with Haley Wagner? Do you recall?
I don't, but it's possible that I did. And when I say physical immediate danger, I mean abuse.
Okay. Okay, I understand. Okay. Were you surprised that the day after you saw Sophia, were you surprised that she was hospitalized?
No, but not because of her state. I am a very when it comes to complex cases like this is the first time that I've ever experienced this, and so it was difficult for me to feel confident to say, yes, I think that she should be hospitalized, or no, based on what I saw, I felt comfortable saying, she's making tears, she's making urine. We just need some education. I mean, I don't have an answer for that.
I understand, and I appreciate that. Whenever you recommended that that new formula, Nutramigen, if I'm saying that correctly, how did the parents respond to that? Were they on board to try that new formula? Or do you know?
They seemed to be on board. They took the prescription, and it was my understanding that they did try to get the prescription. They tried to take it to the pharmacy here that we have. We didn't have it, so I do believe that they were open to trying it.
And if it's not available there in your town, I'm not as familiar with your town, would that be something they'd have to travel to Amarillo to, or is it ordered, or how does that work, or do you know?
I believe they can get it at Walmart.
Okay.
Which is in Dumas, which is not far from us.
I understand. Okay. And again, you made that recommendation on the 21st, but the child was removed on the 22nd, as far as you know. Is that correct?
Yes.
Okay. All right. I'll pass the witness.
All right, thank you. Ms. Ferguson, any follow-up?
No, Your Honor.
Ms. Whittington?
None, Judge.
All right. Ms. Palmer, you've mentioned the parents needed education, and you specifically mentioned parenting. Is there anything else you're aware of that you think that the parents could benefit from?
As far as what do you mean? I'm sorry, I don't understand.
I mean, from what I've heard and kind of what you've testified to, it wasn't a problem with the parents not knowing how to feed and take care of the child, but I've heard education several times, and a doctor has recommended parenting classes, but is there anything else that you can think of to recommend?
No, sir, other
Okay.
than just routine, weekly follow-ups to monitor weight, to make sure that, the feeding is being done.
Okay. Thank you for that. All right. If nothing else, then Ms. Palmer, thank you for your testimony. And I agree with Ms. Whittington. I'm sorry you had to wait so long, but I'll release you so you can go about what's left of your afternoon.
Okay. Thank you very much.
Thank you.
Thank you, Doctor.
All right. Ms. Ferguson, do you have any other witnesses?
I do, Your Honor.
Okay. Is your next one going to be lengthy?
Probably.
Okay. Let's take about a 10-minute or so break.
Okay. Thank you.
Okay. Sir, if you would raise your right hand. Do you swear the testimony you give will be the truth, the whole truth, and nothing but the truth?
Yes.
All right. Thank you. Ms. Ferguson?
Will you state and spell your name?
It's a William Quickle, William Quickkel, quick with an EL at the end.
Okay. Thank you. How many children do you have?
I have one child from a previous marriage.
Okay. And how old is girl or boy?
A girl.
And how old is she?
She's 25.
Okay. And were you involved at all when she was a baby?
Yes, very much so.
So you're familiar with feeding and all of that of a baby?
Yes.
And did she have any issues?
Absolutely none, zero.
Okay.
Bottle fed baby.
I guess I want to ask, why were you involved in the making of the decision?
I'm sorry, you froze about
Oh, I'm sorry.
20 seconds ago.
Sorry, am I good now?
Yes.
Were you involved in making the decision to skip the second newborn screening?
The second newborn screening, and I'm not sure I understand what that was.
The one at 2 months?
Okay, Mr.
I don't understand when that was or what that was.
Mr. Quickle, let me interrupt you. Don't look to your wife for answers. You have to testify solely based on what you can tell me.
I don't remember anything about that.
Okay, don't interrupt me, please. I wasn't through. Your wife will have a chance to testify herself, but don't look to her for answers, and same will go for you, ma'am. All right, go ahead.
Mr. Clickle, you don't know anything about the 2 months checkup?
I can't recall. I think I wasn't involved in too much of the details. I was working at the time, pretty busy.
Okay. Were you involved in the decision to not take Sophia for lab work in April?
Um, that was, I can't remember what date. I believe it was the 14th, but I'm not sure of April. Of April with Allison, with Carolyn McBride.
Yes. So, okay, let me back up. Did Carolyn recommend, were you present at that meeting?
Yes, yeah, both of them, yes.
Okay. And so you heard her recommendations, is that correct?
Yes.
And did you hear her recommend and ask for you guys to take her for blood work, both on the 10th and the 14th?
I don't remember the 10th. I remember the 14th for blood work, and we went to the lab, and it was the same lady that stuck my wife and bruised her arm. And so I didn't feel comfortable with my daughter taking that. At the time, I didn't know you could do a heel prick with a capillary tube. And that's less traumatic for the baby and everyone pretty much. But I didn't want to go through that. I know my stepdad was a phlebotomist, and he says
Okay,
babies
sir,
are the
you've
hardest.
answered the question.
Yeah.
When it's a pretty simple answer, just yes or no will do. Ms. Ferguson?
Okay. So do you recall telling Haley Wagner that testing had previously been done at the 2-week checkup, and you didn't feel like it was necessary to have any further testing as far as lab testing went?
No, I don't believe I ever said that.
Did you ever tell Haley Wagner that sticking an infant with a needle is traumatizing?
I probably told her that, yes.
Do you recall telling her that y'all were going to try supplementing with formula before going through with lab testing?
I don't recall.
Okay. After you've heard the doctors testify today, did you learn anything from their testimony today?
Yes.
What did you learn?
Well, I learned from the doctor's first name, Raphael. I learned a lot from him. I didn't realize there was that much in making that decision to release the child from the hospital. And because all he wrote on the board was release and the prescription of the formula, and that's all I thought that he was about. But he was about a lot more stuff than I thought, and it was about the blood tests, and I realized how important those are. And in the hospital, we did do a capillary. It was wonderful. She cried a little bit, but we got all the blood in the world from her foot, bottom of her foot. And so we did the second blood test that way instead of the previous blood test before that was a mess. They messed up her left arm. They had to go with the same arm as
Okay,
her.
sir.
Yes.
Once
Yeah.
again, you're expanding on much more than the question was asked.
Sorry.
And I just want to clarify, Mr. Quickle, that it wasn't Sophia that had a difficult blood test. Is that correct? It was your wife?
Yes.
Okay, thanks.
Yes. Well, no, she did have
Okay.
answer
Okay.
the question.
Okay, go.
Questions been answered.
Mr. Quickle, I mean, after listening to you said you learned something from Dr. Metamal, in hindsight, would you do things differently?
Yeah, well, if I knew about it, I would do the capillary draw test, but they didn't say anything about it
But so you have to know about something personally before you would take medical advice. Is that what you're saying?
I don't know.
So, is it fair to say that you're a little skeptical of medical advice?
No.
Are you opposed to vaccinations?
No. I just have questions, and I have scientific questions about them, and about them, especially about giving more than the recommended schedule.
Okay.
Vaccinations, yes.
Okay. So is it true that you have asked that that Sophia not be vaccinated with any of the vaccinations that are available?
Yes. At this
Okay.
time.
And do you have any particular religious reason for requesting that?
I have a scientific religion, but mostly a religious belief.
Okay. And what is that?
Oh, you want me to expand? Uh, I have Pennsylvania Dutch heritage from the state of Pennsylvania, and my ancestors come from there. And also, I have the Mennonite church in Wyoming that I went to when I was with my little girl out there in Wyoming, and she took all the shots, by the way, except she took an extra MMR, and it effed her up for like 3 years straight. She was messed up. And so that was an extra shot that our doctor didn't recommend. And that's why I'm kind of cautious with vaccine scheduling.
So you believe that her extra vaccine harmed her in some way?
My first child, yes, definitely.
And can you describe that? How did it harm her?
She turned beet red the night after. It was like she had a cold, but it lasted for like a couple of weeks. We took her in, and the doctor said it could have been that third shot. That I didn't recommend that. And the government nurse for Head Start, we were trying to get her early Head Start, recommended that third MMR for the year, and that's what messed her up. And so we just got to be careful with this in the future, because I don't want any more trauma I don't want to cause any more trauma than I have to.
Were you aware, I know you've heard testimony today, but were you aware of what can happen if a child is low in vitamin K? Your Honor, did they freeze? I think they froze.
But I didn't.
Oh, okay. They're back.
No, I
Mr.
need
Quick,
education on that. I need more
wait.
education.
Okay, Mr. Quickle, let me re-ask it because you froze. Are you aware of what can happen if a child is low in vitamin K?
I can't recall what Dr. Raphael said, but I have it in my notes.
You recall that he said that your baby is low in, or was low in vitamin K at the hospital?
Yes, but currently not. When she was released, she passed with flying colors. That's how I understood him.
Well, is she still low in vitamin D?
I don't know currently what her status is.
Were you having to supplement vitamin D for her while she was in your care?
Yes, we had vitamin D, but there was no blood test that indicates she was low on vitamin D or
Did anybody tell you in the hospital that she was low on vitamin D and low on vitamin K? Mr. Quickle, did you hear my question?
Oh no, you froze up. Sorry, I didn't.
Oh, I'm sorry. I guess I'm the one freezing. Did anybody tell you when Sophia was in the hospital that she was low on vitamin K and vitamin D?
And by hospital, you mean the Northwest Children's Hospital?
Has she been in any other hospital?
Uh, well, she was in a hospital. I just when she was born, but so I'm just clarifying.
Okay. Well, the hospital that we've been talking about all day, that hospital stay.
Northwest Children's Hospital. Okay.
Yes.
Yeah, they gave us a syringe, and we were supposed to drop it in her mouth, which we did according to their prescription.
Okay.
Okay.
And that was vitamin D.
Yes.
Okay. Um, do you understand why medical professionals were concerned about Sophia in April?
Yes.
And what is your understanding of what the concern was?
Didn't weigh enough.
And what, and you did attend all the medical appointments, is that correct?
At the hospital?
Let me just clarify. Were you present on April 10th with Carolyn McBride?
Yes, I attended April 10th.
Were you present on April 14th with
Yes.
Carolyn McBride?
Yeah.
Were you present on April, I think it was 21st with Allison Palmer? Did I freeze?
He's frozen.
Okay.
Sorry, you froze for the last 25 seconds or so. Sorry about that.
Okay. Okay. Were you present on April 21st with Allison Palmer?
Yes.
And then you were present during the hospital stay. Is that correct?
Yes, the whole time. I went back to get a baby seat. I think it was on a Saturday, but I can't remember.
Okay.
But I was right back in the hospital that evening.
So what is your understanding of what Sophia I guess let me rephrase that. So I guess I asked you if you understood why the medical professionals were concerned. And your answer was because she didn't weigh enough. Is it more complicated than that?
Basically, I don't think so, because otherwise they wouldn't have. I think they fed her. We were feeding. So if it's that syndrome where the Nazi concentration camp prisoners got fed too fast, we're feeding her really fast, but we did it. We did it every 3 hours for half an hour, whether she drank it or not. Bottle goes back to the nurse. So we did that. So I'm familiar with that feeding schedule, and we're going to go with a recommended pediatrician feeding schedule. The recommended one, actually, now that she's almost thriving, like 1 pound away from almost thriving, we're going to go with the schedule from the foster family to stick with what works. And
Okay, let me stop you right there. You said almost thriving, 1 pound away. So what in your mind would be thriving?
double the weight.
What weight?
Right now, it should be just about double the weight between 4 to 6 months from my CDC research, but I'm not a doctor. So I'm not a doctor. I'm just saying that from my research.
So what have the doctors told you?
Double the weight at 4 months, maybe they say she should be double her weight.
And so that would be 14 pounds. Is that correct?
Plus or minus from yes.
Okay, so that's way more than 1 pound away. Is that correct?
As a couple pounds, yeah. I don't know what she weighs. We haven't gotten any info on that.
Did you have any specific concerns about formula?
Nope. Maybe to begin with, right when we first got her here from the hospital after she was born, we did have some problems with that yellow bottle that we moved to the FML purple bottle, the purple canister of powder, and that seemed to be better. It seemed to work better, and she wasn't puking it up, but it would still was an issue.
So when she was throwing up, did you take her to a doctor?
I right away, no, we just watched her feeding trends and tried to slow down the feeding, or maybe not fill her up all the way, and see if she's going to puke it up.
And what made you decide to not fill her up all the way? How did you decide to do that?
If she pukes all over you when you're burping her, I don't know.
Okay, so that was on your own that you came to that conclusion.
When she's hungry, we're going to feed her, but then that's how we determine whether she was full or not by scientifically measuring. So we probably should have recorded something, the feeding schedule, to probably come up with a good feeding schedule, and when she seems like she's hungry and she's drinking, and then when she's puking, I don't know. I need education on that.
So when did you first notice that that there was a problem?
Right off the bat when she was born, on the bottles, uh, but I mean she was, I think, on that yellow one. I'm not sure if that's for later kids. I think it's for her age.
He's gonna have to.
Yeah.
He cut out.
Yeah. Can you repeat that? I'm sorry. Or actually, let me just ask another question. Um, okay, so I asked you when you first noticed there was a problem, and you said when she was born. Then why did you not? I mean, you took her to the doctor when she was born. Did you discuss with the doctor about her throwing up?
Yes, yes.
And what did the doctor say?
To try a different version. So we tried the purple, I think, at that time, and that worked a lot better.
Okay. And did you continue on with the formula?
The what?
The purple, I'm assuming, was a formula.
Yeah, that was better. That was available at Walmart, so that's what we used for a while.
Okay. And when did you decide to stop using it?
Uh, we really didn't off and on, but I guess we started the breast. I'm not sure when we started with the breast milk, that seemed to be to put her to sleep better, and I don't know, it seemed to calm her down. So, and I can't
So,
schedule.
Mr. Quick, sorry, Mr. Quiggle, let me just ask you another question. Did you hear the doctor testify earlier today that when she was born, she was in the 50th percentile? Would you agree with that?
When she was born, I
That
don't
her
know.
weight was right in the middle?
Her weight was average, yeah.
Okay. So was there a point where you started to realize that her weight was not average for her age?
Yeah, I can't remember the couple months, somewhere January, February, maybe. No, March. You could see her shoulders get a little thin around, and you could see her ribs, and that's it. That's the main concern that I had, was the skinny arms and the ribs, and right here.
So why did it take you until April 10th to get her into a doctor?
Uh, I think we had a death in the family, and since the baby was breastfed, it had to go with a mom to see her sister with a death in the family. Her sister's husband died, and I can't remember when that was. I thought it was somewhere February, somewhere near February or March, somewhere in there.
Okay. And so your wife went to stay with her sister during the time that she was grieving right after her husband's death. Is that correct?
Yeah.
And you can't remember exactly when, it was like February or March.
Plane tickets. I think we took a picture of the plane tickets and the death certificate and sent it in for evidence. It should be in there. The 14th, I think it was Valentine's Day. And so I don't know when the tickets were purchased though.
Okay. It's okay. Do you understand why the department's involved with your family?
Yes.
And do you do you understand why Sophia needed to be hospitalized?
I'm unclear about that, but yeah, I wanted to talk to Jennifer, the doctor, about that, about why two people are saying she can be fed at home, just increase the calories and versus
Okay. Okay. And do you understand the difference between a physician assistant, a nurse practitioner, and a doctor?
I can guess at it, but no. I would be guessing. I think it's a doctor, but that works under another doctor as a physician's assistant. Has to be probably a doctor that works under a doctor. The nurse is just a nurse practitioner, 4 years degree. The doctors have they have to follow a doctor through a hospital after they get their extensive education, and they're really not a doctor till they have that experience.
Okay. So, do you think it's important for Sophia to see pediatricians?
Yes, yes, and we're not opposed to that. That's for sure. And also to do the weigh-ins at least once a week. If you need more than once a week, we can do it. Uh,
So,
um,
Mr. Quickle, let me just ask you this. On April 10th and on April 14th, Carolyn McBride discussed weekly weigh-ins with you too. Is that correct?
yes.
Why did you not go for a weekly weigh-in
I
after
don't
that?
know. I don't know. I think we had a week after her, and then we had CPS show up at on the 21st, I think, and over here in front of the church. So,
Okay.
mm, what was the
Okay.
question again? I
No,
think I answered it. I think I answered it.
you answered it.
Okay.
Did you, when Sophia was in the hospital, did you refuse a feeding tube?
Yes,
Why?
I did a quick search. I know I'm not a doctor. I just Dr. Google, I looked it up and it said there's a chance of her dying, there's a chance of her suffocating, a chance of going in the wrong place, feeding the lungs instead of the stomach. And also she had a boogie. She had a problem with boogies. She was getting over cold in the hospital. And so that could have been a problem. And also barfing up food. She could suffocate on her own food. And I did all that in like this 30 seconds. I figured that one out. And I said, no. I said, no,
Okay.
I don't want, I think the risk, because we're making progress, I like to stick with what works, which is the bottles. And the bottles were working. We're scientifically getting more calories and doing it safely according to the blood tests. And then, so that's why I said, no, I said, we don't need any more trauma, especially after the last blood draw that we had with the
So,
arm. Yeah.
so the blood test was important to you to show that she was doing well.
The blood test is very important to me. I just didn't like the fact that it takes a half an hour or 40 minutes to get the darn needle in that tiny little vein. And I just don't like watching it I probably should just leave the room and have let the pros take over.
Do you
And
understand what the medical professionals have said the risk to Sophia was when she was admitted to the hospital?
failure to thrive. I didn't really get, that's the risk. The risk was low weight, and that's all I got a risk. I didn't, no one talked to me about having heart attacks or all this stuff that Nazi concentration camp adult victims of that, eating too much and then dying.
Did
Never, no, I need more education on that.
did the CPS investigator ask you to specifically to take Sophia to a pediatrician?
Yes, and I wanted the pediatrician to tell me, or to a pediatrician. I don't know if that was Allison Palmer or what. I don't know,
Well,
but we
so were
did.
you at first asked to take Sophia to a pediatrician in Amarillo?
Yes, to the hospital. She said to the hospital. She didn't say. I don't remember pediatrician. She specifically said the emergency room. We're going to the emergency room. And I'm like, great. Can't wait for the
But
deductible on that one.
okay, yeah, sure. And let me back up. This was before you took Sophia to see Allison Palmer. Were you specifically requested to take her to a pediatrician in Amarillo?
Yes.
And why did you?
I don't know about pediatrician, but ER, that's what she said.
Okay.
Emergency.
And
I
and
remember
so
that.
why did you choose Allison Palmer?
Because she's right here in Stratford. She's not 110 miles in Amarillo. So we went here. I recommended that. We go here, and she followed me over there to Allison Palmer, and she was great. Allison Palmer is brilliant. She gave us a prescription. We knew exactly what we're doing. This will gain weight, and she won't puke it up. I mean, it's good stuff. It's the Rolls Royce for, getting your baby fattened up. So,
And so now, in hindsight, do you understand why the next day you were asked to take Sophia to the hospital?
sound check. Yeah, you froze up for about 20 seconds there. Sorry, Pamela.
Okay, let me try again. Do you understand now, in hindsight, after hearing all the testimony today, why you were asked to take Sophia to the hospital the next day after seeing Allison Palmer?
Allison Palmer. After seeing Allison Palmer, well, Allison didn't recommend going to the hospital, but yes, uh, Haley mentioned it to me like 3 times removed from the doctor. Like it went to from the doctor to the director to the manager to her. And then, yes, I realized
Okay.
I should get to the hospital if it's that serious. I understood Sophia she's still, even though she started feeling around right away around her ribs, I wasn't too concerned about her dying or immediate threat to her. But, I'm not a doctor. So they see the trends. Doctors see the trends. They have lots of patients, and you can't argue with that. So,
Okay. Um, when you were in the hospital with Sophia, do you recall threatening to leave against medical advice?
yeah, I got mad because the wear, they used a different wear, and she came in at 5 grams above her 5 grams for additional weight. And I just was pissed, man. I was mad. I go, oh, great. They're using a different scale here. And then I'm done. I was ready to leave myself. And I was thinking about taking my whole family out of there. And I was wondering if we could leave, if we had the authorization to leave yet. Because I think it was Sunday. Was it Sunday or? I think it was Sunday. And I'm like, great. And then I just said, okay, they said the second weigh in, we'll do a second, we always do a second weigh in 12 hours from now. Can you wait till the morning? And I said, yeah, just weigh her again in the morning, try to get that other weight set working, the other weigh scale.
So
And so they
what
did. They got the other weigh scale working, and she came in like 45 plus grams that day.
So what about the weight scale made you angry?
The fact that it was a different weight scale, maybe, I don't know. She was kind of moving around on it. I don't know. She was really upset moving around on it. So she wouldn't stay still. I don't know if that has anything to do with the inaccurate weight, but it was a different scale that might have not been calibrated the same, or I don't know. Maybe it was a different calibration.
Okay, thank you. And so let me, oh man, okay. Sorry, Your Honor, give me 1 second. I thought I had it up. Okay.
Okay.
And
See it. Exhibit 3.
yes, can you see these pictures?
Yes. There she is.
Is this Sophia? When was this taken?
Early on. It's an early picture.
Okay. What about this one?
Where was that? Let's see. It's really early. December sometime, late December.
Okay, so right around the time she was born, is that correct?
Yeah, about a month or so, 3 weeks. I don't know.
Okay. What about this one?
Not sure. I remember that one, but if it's dated, I mean, it's dated on the bottom of the picture, but I can't recall that one. But it looks like she's doing pretty good. I mean, she's doesn't have the ribs. She doesn't have the ribs. So we just need education on that, obviously.
So
But
what about, I mean, so you think that in this picture she looks like she's doing
yeah,
well?
yes, I'm sorry. Yes. Ribs, the arms aren't too skinny. I know. It sounds, I think I need education on this, but I'm not sure what to look for. So,
And this is a cute one around Christmas time, I assume.
oh yeah, that's a really cute one. And so this was before she started getting really skinny, but yeah, it is. It's because she doesn't have the baby cheeks, the big fat baby cheeks yet. Well, she does there. She's kind of still really small.
Okay. Um, what about this one?
Yeah, she's got the fat baby cheeks. Arms look a little skinny. I don't know.
Do you remember when this one was taken?
No, but it looks like, I mean, if it's dated February 4th, that means about a month after her birth, exactly a month. She looks okay. You really can't tell with the clothes, but
What about this one?
it's a sad baby. Oh, Christmas baby. It's got to be close to Christmas.
Okay.
It's got to be, yeah,
And this one too?
yeah, yeah. That looks
And
a
when
little,
was this taken?
little tiny. Yeah, she looks small, smaller, and she's like her cheeks are,
Do you remember when this picture was taken?
no.
Okay.
It says March 17th, but yeah, it looks a lot. Looks like it's more like February or sometime.
What about this one?
She is. Uh, I don't recall, maybe February, mid-February. But yeah, you can tell she's getting a little bit, still has puffy cheeks.
And then that one. That's a cute picture.
I love
What
it.
about this? When was this taken?
That was taken after the Catherine McBride appointment on the 14th. So we just put up a carpet behind us, you can see, and then that's when that was taken for
And
sure.
who are the people in the picture with you?
That's my mom, Grandma Andy, and Vaughn, Papa Vaughn, is Grandma Andy's husband, and my stepdad.
Okay. And so, did they come and stay with you guys in April?
Yes.
Do you remember what the dates were?
I think it's Sunday night, Monday, Tuesday, Wednesday to Thursday night, and they left, I think, Friday morning, but I'm not sure. I think it was a 5-day visit, pretty much.
Okay. So, were they staying with you guys when, on April 14th, when you took, Sophia to the second appointment with Carolyn McBride?
Yeah. Yes, and we were on the bottle. We were on the bottle, and she was just starting to gain about a half a pound after our 14th, or on the between the 14th and the time she saw Allison Palmer. So we were gaining weight, and we were supplementing at that time. You just can't see it yet because we just did it. It was like a week.
Did your did your parents express any concern about Sophia's appearance?
Yeah, my mom did. She's kind of skinny, and I go, yeah, but we're trying to fatten her up with the supplementation, and we did so. Everywhere we went, we were giving her the bottle.
What about
Um,
this one? Sorry.
yeah, that looks like it's a recent one. Maybe in the hospital.
Okay.
Because I recognize the band. I don't, but
Okay.
you can see her arms are a little bit more fatter, so that we've got her really fattened up. I think this is maybe Sunday or Saturday night in the hospital. So we had already been there Wednesday night, Thursday, Friday. So this might have been Saturday night or Sunday.
So do you consider this, you said fattened up. Do you consider this fattened
No,
up?
no, I'm just saying she's getting better on her arm. So
Okay.
you know what? To be honest with you, I don't know what she's going to look like when she's thriving.
Okay.
I, I need education on that.
Was this also in the hospital?
Yeah, I think so. I don't
Okay.
know. She's looks like she's doing fine, but
And is this a recent one at a
uh,
visit, maybe?
oh yeah, I recognize that dirty carpet. That's at the foster care facility. And we brought that for tummy time because we didn't have our tummy time thing yet that we ordered. It just came. So we're having fun with that tummy time stuff. Aunt Laura gave us that.
So let me ask you this. All these pictures that I just showed you, have they been altered in any way?
I don't see it. No, it looks like my baby, unaltered.
And and so are they an accurate depiction of the events that we just talked about? Do they depict everything that you just described?
Uh, Probably, yes, yes.
Okay. Your Honor, at this time, I would ask to admit Petitioner's Exhibit 3 with all the pictures.
All right, objections?
No objection, Judge.
All right, petitioner's 3 is admitted.
All right. And so, Your Honor, I've got to figure out how to stop sharing my screen.
I can't help you.
This is a cute.
Oh, up here. Yay. Okay. So going through all those pictures, do you see the concerns that the department had?
Yes,
Okay. Do you see the concerns that all the medical professionals that you interacted with had?
yes. Some of them, yes. There was a lot of them. There was like 15 doctors and undergraduate doctors at the hospital.
Was there anybody at the hospital that you didn't agree with?
No, no, I don't think so. We just put out. They asked us questions. We put out alternative, if there are any alternatives to stuff, if we're trying to, like for the pricking of the heel, that was a great idea. Whoever came up with that helped us out a lot. It was, I think it was the guys in the lab or something, and so they did a good job. And anyway,
Okay. Let me ask you this. Did the department ask you if you had names of anybody in your family that could come and be a safety monitor, stay with you in your home?
yes,
And did you provide the department with those names?
yes.
And do you have any family members today, as you're here, that could stay until the court says otherwise for at least
Indefinitely,
6 months?
last 6 months. No, we can't seem to get anybody to come out. I guess some people would have to quit their job or something and come out. Um, no,
Okay.
but
And you've
Grandma Andy said she could come out, but not for 6 months.
so you filed a motion for this case to be dismissed. What is it that you want to happen today?
I want us to immediately have possession of Sophia, full custody with guaranteed weigh-ins, weekly weigh-ins with Allison Palmer.
So if the court dismissed this case today, how would the court be able to guarantee that you would do the weigh-ins?
The weigh-ins, because we're not doing the weigh-ins ourselves. We understand that. We're just doing the weigh-ins for our own benefit to see that she's gaining like every day. But weekly weigh-ins would be the proof in the pudding for you guys. And we will absolutely do that. Actually, for us to get an official weigh-in, we would like to use our local person here.
So you want to be in control over who you take your child to see?
Yes, and Allison Palmer, well, I would, yes. I mean, I would like full custody, because if we don't have full custody, it's like we could, I don't like to say this, but it was terrorizing to get pulled over by the cops and a CPS and then have over here, in front of our church. It was humiliating and terrorizing, and we don't want that to happen again. So I guess we do the weigh-ins, and then as soon as she's weighing good and she passes her health checks, if there's any issues, we're going to be referred from this local clinic to either Dalhart or Amarillo. I'm willing to go to Amarillo to even do a blood test if it's once every week or so. I not daily. I would want to do daily blood tests, but we
Sure.
can.
Okay, let me stop you there,
Reasonable.
Mr.
I just want
Pickle.
to do
Yeah,
reasonable
we
stuff.
get the gist. Your Honor, at this time I pass the witness.
All right, thank you. Ms. Whittington?
Thank you, Judge. Mr. Quickle, how long have you lived in Stratford?
Approximately 8 years.
And where do you work?
I work with the old CenturyLink building with Lumen, and although my paycheck says it's coming from level 3, that's just accounting.
Okay.
Yeah. So I've been here
And
for
what do
8 years.
you do there for? What do you do there for?
I do corporate internet for corporations and government, all the government, including all the agencies and everyone.
Okay.
And most of the corporations that AT&T is not doing. In fact, every corporation that AT&T is not handling, we're handling. So pretty much it's like 50-50 on the corporation in corporate America is done through the
That's
Stratford.
okay.
Yeah. Okay.
Thank you. And how long have you been married to Tanya?
We've been married since 2022, 9th of May.
Okay.
9th of May, 2022.
Now, when you went with your wife to see Carolyn McBride, what was the purpose of your visit?
The purpose was we had our daughter was getting a little skinny.
Your internet there is not good.
No.
Okay, so what was the purpose of your visit? You cut out on us.
The purpose of the visit was she was getting kind of skinny in the ribs, and we just wanted to check it out. And also the arms were a little skinny, so we're definitely wanted to check that out to make sure she doesn't have any.
Okay. And when Miss McBride recommended supplementing with formula,
Oh yeah,
did you guys order that formula that she recommended?
absolutely. I could have sworn it was either that same day or the next day. I think probably the next day, or maybe the same day, the same night I ordered it. I think I ordered it while I was still at work before I left work and came home that night, but I'm not sure. But it came a couple days later, maybe 3 days later when by that time we were already in the, oh no, that was the
Judge,
cabrita. That was the cabrita. Sorry. That was the cabrita that I ordered. And we got that this practically a couple days or the next day. And so we started on the cabrita and that
that's
stuff.
good. Judge, may I share my screen?
Yes,
Thank you.
I'll watch for the prompt where I allow it.
Okay, can y'all see it?
Oh yeah. That's the good stuff. I think it was a bigger can than that. It's a bigger can, but that's basically the gist. I mean, the
Okay.
picture it shows a small can, but it was a big can. That's it.
Good. And Judge, I have what's been marked as Exhibit 10. If you'll look at it for me, Mr. Quickle, you said this looks like the formula that you ordered.
Yes,
Okay. And
we got that here.
what about this formula?
Yes, that was the one that I ordered after the appointment with Allison Palmer. That's the one she recommended.
Okay. And did you or Tanya supply me with these what looks like receipts and pictures
Yes,
for this? Okay.
we took all the Allison Palmer prescription and gave it to the hopefully the Foster family on our first visit.
Mr. Quickle, are these pictures a fair and accurate representation of what you submitted to me?
Yeah, except the Cabrita can's a little small. It's like a big extra.
I'm sorry, you're not understanding the question. Is this receipt, what appears to be a picture
Yes.
of a receipt, is this
Yes.
what you presented to me?
Yes, and that's correct. That's all. That's my receipt for Cabrita
Okay.
to the appointment.
Does it appear to be modified at all from what you submitted to me for this hearing today?
No, and that's a Cabrita milk we got that was recommended by Catherine McBride.
Judge, I would offer Exhibit 10 to be admitted.
Okay, I saw the Cabrita can and then I saw a brief glimpse of another can. I didn't see anything about a receipt.
So this is the receipt, this first order receipt, Judge, of the Cabrita can.
Okay, that's just he ordered it online apparently.
Yes, sir.
Okay, all right. I still don't. I guess that's what y'all are calling a receipt. So okay. Any objections to petitioners? What was it?
Exhibit number 10.
10. Petitioners 10. Any objections?
Respondent.
No objections.
All right, petitioners 10 is admitted.
And Judge, it's the respondents. I apologize.
I'm sorry. Yeah, respondents, not petition. Do you want?
Thank you, Judge.
Uh-huh.
And so, Mr. Quickle, looking at this order of the receipt for the Cabrita, do you see here where it says when it was delivered?
Mm-hmm.
And what is that date?
The 15th of April, right after our
Okay.
appointment. Yeah, right after our appointment. So
Okay. So your appointment with Carolyn McBride was on April 14th, where you discussed the goat milk, is that right?
yes,
And this is showing that it was delivered the next day, is that right?
right.
Okay.
It's great stuff.
So while she was using this formula, is that where you started noticing that she was gaining weight?
Yeah, right around her ribs, and that went away. And then her legs, they started noticing her legs, and then later her arms, but not really. But mostly her ribs and her legs started filling
Okay.
out.
Thank you. Okay. Okay. Do you recognize this picture?
Yes,
And did you present it to me for preparation of this hearing today?
yes.
And what is this? What is this a picture of?
It's a weigh scale for babies.
Okay. And is this picture of this receipt, is it a fair and accurate representation of the receipt that you gave to me?
Yes.
And has it been modified in any way?
No.
And Judge, I would offer Respondents Exhibit 8 into evidence.
Okay, objections?
No objections.
Respondents 8 submitted.
Thank you, Judge. Mr. Quickle, will you tell me what this date says here on the date that it was ordered, that this baby scale was ordered?
Baby scale ordered on April 10th, apparently.
Okay. And was that the same day as your first appointment with Dr. McBride?
Yes, April 10th was a Dr. McBride appointment.
Thank you.
Baby drop.
Mr. Quickle, if you can see what I have on my screen currently,
Yeah.
do you recognize this picture?
Yeah, that's where baby drops.
Okay. And did you give me this in preparation of today's hearing?
No, I think Tanya did.
Okay. Did you see it before she sent it to me?
No. I think I did might have, yeah. Yeah. So baby drops.
Okay.
The department has no objection.
Thank
Okay.
you. Thank you, Judge. I'd
No
like to
objection.
offer this exhibit number 9.
Respondents 9 is admitted.
Thank you so much for that. Okay. All right, Mr. Quickle. So in this particular picture, it says that these vitamin D baby drops. Do you order those for Sophia?
I didn't know. I don't believe I ordered those. I think Tanya did.
Okay. So, do you see here where it says it was last purchased on April 12th?
Yeah.
Do you see that?
Yes.
Okay. And prior to this, had you guys ordered vitamin or bought at the store, either you or Tanya, vitamin D drops for Sophia?
Yeah, Tanya bought that lots of vitamin D drops, yeah. So we always
Okay.
had some on hand.
And to your knowledge, were you guys giving this to Sophia?
Oh yeah, yes. I for sure.
Okay. I think I'm done with my screen sharing for now, Judge.
Okay.
Let's see. Now it's to stop sharing. Oh, here we are. There we go. Thank you. Okay, Mr. Quickle. So is it fair to say that you would do things differently if you knew on April 21st what you know today?
Absolutely.
So there's been a lot of talk about you being opposed to needles and things like that for Sophia. Would you agree that's been the assessment today?
Yeah, in the wrong hands.
That's okay. So now you mentioned that at the hospital, when they drew Sophia's blood, they did something different. And why did that matter to you?
Oh, they sent a team up with a capillary draw for several capillary tube draw tests. And so that's what was different than the previous where they did the old fashioned where they go inside the vein with the needle and they take a little vial of it. That's what your difference was. Is that what you're talking about?
Yes. And so if you'll describe that to the judge, a normal blood draw you said was through the arm, and this one was where?
Through the heel, and apparently they can do that when they have a local lab right there. I, I don't know when they can do it actually. I just know that they did. They sent a team up, a capillary guys, and these guys were great. These guys were pros. They had a little pack of heat that they broke, and it heated up her heel. I think it was heat, and then they, right when they put that on for like a couple minutes, and then right when they poked her really quick, and it was pretty much over. She stopped crying like almost right away, just after about a minute or so. And then they got their blood draws that they needed
Okay.
to determine her health.
And so for you, are you more concerned with the least invasive procedures as necessary for Sophia? Is that fair?
Yes, if the least invasive is the least trauma for my little girl, yes.
Okay. And you're asking the court to dismiss this case today, but are you willing to abide by any safety plan the department may have for you?
Yes.
Okay. And if that safety plan requires further lab testing, are you willing to comply with that?
For the lab testing, absolutely.
Okay, I pass the witness.
All right, thank you. Ms. Lucero?
Thank you, Your Honor. Mr. Quickle, as far as the exhibits that y'all presented today, being the formula, the Cabrita, and then the Nutrigen, however you say that one, did you provide that information to anyone at the department prior to Sophia being removed from your care?
I told everybody. I told both Haley Stovall and Haley Wagner about the Cabrita and that we wanted to continue on that. And I just practically begged her to continue on that rather than go to the hospital or a doctor's we don't know in Amarillo, 110 miles away. I just would, but anyways, yes.
Okay. What about the Nutramigen after it was prescribed for her? Did you let either of the Haleys know there at the department that y'all had ordered that?
Yes, I believe I showed him the prescription slip. I had a picture of it. Um, and I also showed everybody at the hospital, probably all 15 doctors that took care of us, the prescription slip picture. And so that's how they really determined what this formula was going to be for the weight gain of the baby. It was all Allison Palmer's prescription.
Okay. And what about the drops, the vitamin D drops and the scale? Did you let the department know that y'all had ordered that?
I don't recall.
Okay.
I believe yes. I believe I told someone about the scale. We're weighing her and we're going to determine that she's gaining weight. And so that's why. So we know we're going to stick with what works. If this works and she's gaining weight, we're gonna do that. That's why we got the scale. But I can't recall if I told anybody that we had a scale, and I'm pretty sure I did.
Okay. All right, Mr. Quickle. Now, is it your priority to have Sophia placed back with you and your wife?
Yes, I think she's best here for less trauma for her. It's just best to be in one family, not between two different families. and with us thriving, and we're going to get her thriving.
Okay.
And
Now, if the court today were to order that she be placed back with
little
you,
baby.
He's
Okay.
frozen, Lucero.
I'm sorry. Am I frozen, Your Honor?
No, he was.
Okay, I
I
apologize.
don't think he heard your question.
Okay. Mr. Quick, I'm gonna back up a little bit. You stated that your priority is to have Sophia back with you and your wife at your home, right?
Yes.
Okay. Now, let's say that the court decides today, okay, we'll place Sophia back in the home, but under certain conditions. So just to be clear, if the court places Sophia back with you and your wife today or tomorrow, depends how long that would take, and ordered you that she had to go to a weigh-in every week, would you follow that?
Absolutely.
If the court ordered that if the doctor or it's requested that she has to submit to blood draws to make sure that she's still doing well, will you agree to that?
Absolutely.
Okay.
Yeah, even if they're the other kind of blood draw, that's kind of more complicated. Yes. Yes.
Okay. And as far as letting the department come into your home and observe how Sophia's doing, you're willing to do that?
Oh yeah, we welcome those guys. Anyone who wants, yes.
Okay.
Stop by anytime. Absolutely.
And you've stated a lot during your testimony regarding like education and things like that. I know that you had a daughter, she's 25 years old, but since this case has started or since Sophia's been removed, have y'all taken any kind of parenting class or anything like that?
Yes.
Okay. What type of class did both you and your wife take that class or classes?
Yes, we are taking them together and then we get a certificate at the end of the class. I think we've taken 3 or 4 classes. I think for 3 for sure.
Okay.
Okay.
And what did you just briefly, what did you learn from those classes?
Oh, well, let's see. We have milestones. We have these milestones that we have to pay attention to that are important. Um, the tummy time is something new that I didn't do with my daughter,
Okay.
my first daughter.
So you've learned that tummy time is important for
Yeah,
a baby?
yeah, I'm
Okay.
learning things. I'm learning new things.
Okay. What about feeding? Have y'all taken any classes on feeding?
Yes, that was the baby's first bites, I think. The 0 to 6 months, and also 6 months to a year, I think, or 6 months to 2 years.
Okay.
So,
Now, if the court were to order you to take any other classes, let's say additional parenting classes to assist you, are you willing to do that?
oh yes, absolutely.
And any other services that the court would find would be beneficial for you, your wife, and Sophia, you're willing to do that?
You froze up.
Okay,
You
I'm
froze
sorry.
up for about 20 seconds or 15
Okay.
seconds.
I was just saying if the court were to order you to take any other parenting classes or any other classes that would be beneficial for you, Sophia, and your wife, are you willing to do that?
Yes, that'd be great.
I'll pass the witness, Your Honor.
All right. We'll start with you, Ms. Ferguson. Any further questions?
Yes, Your Honor, just a few. Mr. Quickle, the classes that you took, did you go in person to take them? Did you take them online? How did you take them?
We took them online.
And how long did it take you for each class?
Approximately 40 minutes, 45 minutes.
And who puts on the classes that you took? Where did you take them from?
It was at the WIC website. I'm not sure what the address for that is. I have it on my phone.
Did when you were concerned about Sophia's weight and you were seeking advice from the medical doctors, did you seek out any classes then or any information?
When we were seeing
let me narrow it down. In February, did you seek out any information about feeding Sophia?
No.
In March, did you seek out any information about feeding Sophia?
Well, information as far as official courses, no.
What information did you seek out?
Just stuff on the internet.
And can you remember what the internet told you?
Uh, why she would be getting thinner or something, colic, colic babies, or everything to do with being thinner. At that time, I think I can't remember. I think it was in late March or April, after she came back from her sister, from her from the funeral, her sister's husband's funeral. That's when I started looking, and I started getting concerned.
Okay. When the department first contacted you, did you invite them over to your house?
The department contacted me at my house. That's the first time I got contact. I asked them why they didn't send mail correspondence, and they said we don't do that or something like that. So they were corresponding right with me
Did you
direct.
ask them to correspond with you only by mail?
No, I just said it's kind of unusual to get anything legal without a warning in the mail or something in the mail that says, hey, you might not be following the law here, or something, you're breaking the law, or you got 3 days to take these courses, or do something.
So on April 20th, did the department make any contact with you?
April 20th? No, I don't think, no. Not
Did they
April,
leave anything at your door?
April 20th. I did see a card there, but I thought it was a salesman. The card was just, I paid no attention to it.
Did the card ask you to call that number?
No, it was just a business card. But yeah, I kind of ignored it.
And on April 21st, how did it come about that you met the department in a church parking lot?
My wife called me over. She was with the baby in front of our church facing Main Street, in central Stratford, in the city center. And she called me, and I got over there in 5 minutes. And so Haley Wagner was just asking me questions, and she had some forms for me to fill out. And
So did Haley ask to meet y'all at your home?
I believe yes. She said, yes, let's go to your house. And she came in. I think she did something with her. We let her in, and she did something on her computer, and we signed one form. I think it was a medical consent for Sophia's records. I can't remember.
Okay. Okay. But is it fair to say that at first you insisted on meeting in the church parking lot?
I didn't insist no on meeting. No, no, that's not
Okay.
correct. Okay.
Okay.
That's just where she stopped Tanya, with the cop right there.
Okay. Pass the witness, Your Honor.
All right. Ms. Whittington, any further questions?
Yes, Judge, thank you. Mr. Quickle, is it fair to say this is your first time exposure to CPS?
Yes.
If I may show again my screen, Judge.
Mm-hmm.
Mr. Quickle, do you recognize what's on my screen here?
Yeah, that's one of the courses we took, I think.
I'm gonna scroll
Baby's
down.
first skills. Yeah, baby's first skills. And then baby's first bites. Yes, I recognize those.
This one.
And breastfeeding, yeah, yes.
And what are these?
I think there's this program called WIC. I don't know what it stands for, but it's just helps parents, um, train to understand what's going on with their kid.
Okay. Do you recognize these as the certificates of the classes that you took through WIC prior to today's hearing?
Yes.
Is that a fair and accurate representation of the certificates that you gave me?
I think there's baby's first bites. It should be in there too. That's an important one. Oh, there it is. Okay.
And have these been modified in any form?
Your Honor, the department has no objection.
Anyone
No
else?
objection.
All
No
right,
objection.
this is what, respondents 11? Yes.
Yes, sir.
Respondents 11 is admitted.
Thank you so much. Mr. Quickle, do you recognize what's on my screen now? Mr. Quickle, do you recognize what's on my screen?
Yes.
And what is that?
Well, technically, it's a place where the baby sleeps.
Okay.
A crib. That's what they're called.
Do you recognize this picture?
Yes, that's what I put that together. I built that. It took me like a week. I don't know how many.
All right. And do you recognize this picture as well?
Absolutely. That's the baby changing station and chest of drawers.
Okay. And this one? Do you recognize this picture?
Those are the extra big cans of Nutrimogen, and that's Cabrita. The big can.
And what about these?
Yeah, that's Aunt Laura's tummy time. The ABC's right there on the floor, carpet, and then that's our rocker. I got our rocker. Helps a little bit. That baby carriage is really helpful for going on walks. You can feed her, and then she takes a nap when you go on walks. And then that's this miracle thing on the right with all those the dangling things. That's some kind of miracle thing that Grandma Andy got, where you can put her in there, and she practices rolling around. I swear. She puts her leg up, and then she almost rolls in
Okay.
that thing, and she stays busy with it for like 15, 20 minutes straight. And that's our stuff that we got on the first visit. We gave them all our cans of, well, the first prescription that we ordered of of the Nutrimogen, and then all those clothes and stuff. And then below that is our latest tummy time purchase, because we're starting to take tummy time seriously.
Okay. All right. And are these a clear and accurate representation of what they look like they show?
Yeah, that's exactly like what they show.
Okay. And have they been modified in any way?
Nope.
Okay. Judge, I would offer Respondents Exhibit 7.
All right. No objections?
No objection.
All right. Respondent 7 is admitted.
Okay. Mr. Quickle, just going back to this last picture, or one of the last pictures. This picture here, did you say you took that to your visit with Sophia?
Yeah, I think that was the first visit. Yeah, the first visit, we took a bunch of clothes, all those wet wipes, and the big thing of big box of diapers, and those 4 cans to help Sophia out a little bit, and also some baby powder in there. And there's a can opener. We figured they might not have a can opener for the cans, so we got a can opener.
Okay, that's very good. And why did you do that?
Because I love my baby. I love her.
Okay, very good.
To help
Now,
the
Mr.
family out.
Quickle,
Yeah, in case they don't have a lot of change when in between watches and stuff, it'll help the family out. That's taking.
yeah,
Yeah.
okay. Now, Mr. Quickle, if the current placement who's had what we've heard is good results with Sophia gaining weight, if they were to provide you with her feeding schedule, is that something that you and your wife would follow?
Yes, absolutely. We like to stick with what works. That sounds like a wonderful plan because she's really looking good. She's actually looking like all the other babies.
Yeah.
So that's
Um,
really happy for us. We're very happy to get that schedule because that's golden. That's like golden. Whatever they're doing is what we're going to be doing.
and during this time, Mr. Quickle, did the department offer uh, education or any skill development to you
Uh,
since Sophia's been removed?
no, we kind of figured out WIC on our own. Like when they offered WIC for free baby food or something like that, I said, no, I'm never going to qualify for that. But that's why I said no to that, not because no to the formula or anything, but I just don't, we're not going to qualify for that. I already checked into that's $49,000 on the family, and we don't qualify for that per year. But anyways,
I'm glad you brought that up. So there was some testimony today about you declining those type of services for milk products or formula. And so explain to Judge why you declined that.
I just knew I wouldn't qualify with my income. Sorry.
Okay.
Sorry
Okay.
about
That's
that. I probably should have made it clear to them, but I thought I mentioned that. No, I'll never qualify for that because my income's too big. Maybe I said
okay.
it, maybe I didn't explain to him that I just said I don't qualify. I will not qualify for that. I'm pretty sure. No way.
Okay. Um, did the department make any efforts to return Sophia to you?
No, we would really like to have some classes in helping us understand the failure to thrive.
Your Honor, I, I'm going to object to the legal conclusion nature of that question.
Overruled. It's just whether they offered it or not. That's a fact, not a legal conclusion.
Well, I would object to the make efforts to return the child home as a
Okay,
legal conclusion.
I'll sustain that, but asked if classes were offered, that's not a legal conclusion.
Yes, thank you, Your Honor.
Mr. Quickle, are you telling the court today that you need more education before Sophia's able to be returned to you today?
No, once we get that feeding schedule, I think we can continue on with that. Plus, we've taken 3 classes on our own, and I think we've got a handle on it.
And while you were in the hospital with Sophia, Maddie Ortiz worked with you also, correct?
Yeah, she was great. She went over a lot of things that we could have had concern with, and the feeding, and so we followed her lead for the rest of the time in the hospital as far as the feeding schedule.
Okay, I pass the witness, Judge.
All right. Ms. Lucero, anything else?
I have no further questions for Mr. Quickle, Your Honor.
Mr. Quickle, I have a question. You just now said just a minute ago that you don't need any further education. I counted at least 5 times during your testimony that you've said, I need more education on that. What do you mean by that?
When I said that was the context of not knowing the answers to everything like a doctor would. And, we're not trying to get a medical degree here. I just want to hear from doctors mainly and from maybe some WIC courses that specifically help us out in our situation, our specific situation.
So you do think you need some more education. It's just, I guess I'm not following you. You either do or don't. You either think you've got it handled as long as you get the feeding schedule, or you need some more education. I'm trying to get a handle on which it is.
I don't think on the feeding, I think we got a handle on the feeding, but on the possibly, I can't remember the context when I said there was a main context that I said I need education on that.
Let me ask you this: Are you needing to talk to some of these medical professionals, like you said you didn't understand all the risks that this could maybe your baby could die, or
No,
Are
I
you
understand that. I understand that now that Raphael explained everything concisely.
okay? So,
So
so what you're telling me now is you don't really think you need any more education. You just need the feeding schedule, and you'll follow it, and everything will be
feeding
rosy.
schedule is nice, but we'll continue with education past the 6 months. I think that would help us.
Okay, you said you started some counseling. I saw what you did for the WIC program, but have you made the department aware of what y'all are trying to do? Are you doing online counseling or parenting, or which was it?
Neither. We're just
Okay,
focusing on Sophia
okay,
getting her fed and
all right, okay, I got you.
the
I got you.
milestones. The
I got you.
milestones.
I got you.
Okay.
All right. If no one has further questions for him, Miss Ferguson, any other witnesses?
Your Honor, finally, I call Haley Wagner.
Okay. I'm going to take about a 5-minute break real quick. Thank you. If you'd raise your right hand, you swear the testimony you give will be the truth, the whole truth, and nothing but the truth.
I do.
All right. Thank you. Miss Ferguson.
Hi, Haley. Can you state and spell your name for the record?
Haley Wagner, HALEYWAGNER.
Haley, you've heard a lot of testimony today. As far as the medical testimony, is that what the department used to express our concerns to the court as far as the immediate danger to Sophia?
Yes, ma'am.
So the department relied on the doctors, is that correct?
Yes, ma'am.
When did you first interact with the parents?
April 21st.
Okay, and how did that first interaction happen?
I arrived at the home. Local law enforcement was present due to concerns of dad making prior statements that the department was a scam over text to an on-call worker. And so he was familiar with the family, and so he said he would assist me. I got to the home, and local law enforcement recognized mom and said, "Hey, she's approaching from the corner." As I was walking up to the home, so I came off the sidewalk, saw mom. She turned around and went the opposite direction. So I followed her on foot behind her, and then local law enforcement kind of rounded the corner, and ultimately she stopped in the church parking lot.
Okay. And that was the parking lot of the church that has been mentioned earlier?
That is correct.
Okay. And how did that conversation go?
So mom stopped, or law enforcement stopped her and said, "Hey, they're needing to talk to you." So I approached her and just introduced myself.
I'm sorry, what?
Was she present during that conversation? That was unclear to me. Between the law enforcement officer and mom.
Was I present?
Yes.
Yes.
I was at a distance, and I could see him pointing at me.
Okay. Then I would object, Judge, to any conversation between the officer and mom if Ms. Wagner was not present where she could hear herself.
You didn't hear it, Ms. Wagner?
I just saw him pointing at me.
Okay, sustain.
So, Ms. Wagner, you saw him pointing at you, and what happened next?
So I approached her, I introduced myself, identified as an investigator of Child Protective Services, and let her know that we had received a case and I was needing to speak with her regarding her households. Mom stated that it was time to feed her baby and she needed some privacy, so she stepped over to a different area of the church, and I just kind of stood aside with law enforcement while she did that. And then a little bit later, Mr. Quickle arrived at the church.
Okay. And so did you see mom using her phone, or?
I did not. Her back was away from us.
Okay. And what happened when Mr. Quickle arrived?
He approached me and asked what was going on. So again, I introduced myself, identified as an investigator, and I even showed him my badge just because there was previous concerns that the department was a scam. And he just expressed that he felt like the department would make contact with families on Saturdays because we were a government agency. And so I assured him that the person who did try to contact him over the weekend was an investigator, and she was trying to locate them and speak with them regarding this report that I was there for that day to speak with him about.
Okay. And then did he talk to you?
I went over the notification of rights, and he did sign it, and then he included a note on it that said under duress on the form. And then Miss Akrish was there as well. When I read the notification of rights and I asked if she would like to sign it, and he said she doesn't understand anything. So at that point I just said, well, I'm speaking to her. And so went over it with her, and then she ultimately signed it as well. And then I kind of explained the process that I needed to observe the baby. Oh.
Let me just stop there. When you spoke to her, what language did you speak to her in?
English.
And did she appear to understand you?
Yes, ma'am.
And is she appearing here today in court without an interpreter?
Yes, ma'am.
Thank you. Now, what happened next?
So then I just kind of discussed with the family kind of like what the process was. And then I did request to get photos of Sophia while we were standing there. And then I explained, I would interview them, I would do a home assessment, and then ultimately I would discuss information gathered with my supervisor. And so that's kind of the process that it went.
And so did you discuss the allegations with them?
Yes, it's on the notification of rights form. It did state like why we were there.
Did they have any questions about the allegation?
Mr. Quickle did not understand medical neglect, and he did ask several questions about like as soon after you interview us, are we good? Are you going to leave? Like he asked lots of questions of like kind of like when I would be done. And so I just explained, I have to gather this information first and then ask to go through my supervisor, and then I will relay that information to you guys of how kind of the process to go.
So how did it come about that they took Sophia to Allison Palmer? Did you have anything to do with that?
Yes, that was a directive given to me due to concerns of the appearance of Sophia, just to ensure she didn't need any further medical attention. And so the original directive was that she needed to go to the hospital. And Mr. Quickle reported that they could not afford the copay with their insurance. And so he actually suggested the idea of taking her to the local clinic, which was ultimately approved by my supervisor.
Yep. And then what happened?
So they loaded Sophia up in the car, and then I followed behind them to the clinic. And they went into the clinic, and I just waited outside. And I did make a phone call to Miss Palmer just to let her know, hey, I'm working this case and I have sent this family in. Is there any way you could work them in? She said she saw the family in there and said, yes, we will arrange it in the schedule.
Okay. And did they come out after seeing Miss Palmer?
Yes, ma'am.
And did they tell you anything about the visit?
They said that she prescribed them a high calorie formula, and they had a prescription for it, and that they were willing to fill that prescription.
Okay. And what happened next in your investigation?
So well, before that, I had also spoken with Allison. I don't know if you need to know that, but she basically just gave her observations that there was development concerns for gross motor skills. Baby was, underweight for her age, and then it recommended an ECI development. And so I did talk to the parents about getting them into ECI. And then following that, they went home. Baby was fussy. They'd been, dealing with me all day and then at the clinic. So they went home. And then I spoke with my supervisor, and we ended up doing a three-way call with mom, myself, and Supervisor Jordan to discuss what Dr. Hansen had reported to the department.
Okay. And how did they respond to the information that Dr. Hansen believed that the child needed to be seen at the emergency room?
They did have a lot of questions. They wanted to know who this person was. They'd never heard of her. They wanted to speak with her and hear it first from her. And so we did explain who Dr. Hansen was, what her credentials were. I let them know that they could look her up online to see her profile. And we also provided an office number for them to reach out to as well that day.
Okay.
I will note that this was after hours as well at this point. So.
Okay. And so at that point, ultimately, the department ended up seeking a order to aid an investigation to take the baby to the emergency room. Is that correct?
Yes, the family reported they wanted to think about taking the baby overnight. And we never really heard anything that they did. And so that's why we ultimately got that order to aid, just because Dr. Hansen did mention immediate concerns for the baby.
And what were you involved in that process at all?
With the order
Taking
to
the baby
aid?
to, yes.
Yes, ma'am. I along with investigator Stovall, were the ones that presented the order to the family that next day. And I was the transporter of mom and baby to the hospital.
And so you did offer that mom could ride with Sophia in the car with you. Is that correct?
Yes, we got that approved by supervisor.
Okay. And how did the parents react when you told them that there was a court order to take the baby to the hospital?
Miss Krish didn't have a whole lot of reaction, just very calm. Mr. Quickle just asked a lot of questions, asked if like where the judge's signature was, who this judge was, if he was local, why he wasn't local. So just explained that with CPS, we have a judge that oversees all of our cases, and he's out of Amarillo ultimately.
Okay. And did they ask any questions about Sophia, about?
Not that I recall off the top of my head.
Okay. Did you follow up with the family after? Well, what happened when you got to the emergency room?
So I presented the order to the emergency room and just let them know that this examination had been court ordered. And so we got him checked in. Mr. Quickle did follow us to the hospital in his personal vehicle. And so during the check-in process, again, Mr. Krish was calm, did as directed, and Mr. Quickle, you could tell he was a little bit flustered and just said that he was being forced, he was under duress, and just asked a lot of questions and of the medical staff, and yeah.
So even after hearing that there were significant medical concerns for the health of his baby, he said he was under duress to get her examined.
That is correct.
So at the hospital, what happened?
So they did a check-in. A baby did vitals and stuff like that, and then they put her in like a bay, and then some nurses came in to gather information. An emergency room doctor came in and spoke with them, and examined her and just said that her appearance is very small, and that they needed to do lab work, and Again, Mr. Quickle questioned why lab work wasn't necessary, if it could hold off until the next day because it was past her bedtime. And he just asked lots of questions to the doctors and medical staff at that time. Neither when they were asked the diagnosis of the child, if the child had any diagnosis, both parents denied and never reported that there was failure to thrive. So ultimately, I was the one that reported that.
Okay. Did you follow up with the family after that day?
I did not, due to being on personal leave.
Okay. Okay. But at some point you picked this case up again, is that correct?
So it was me and investigator Stovall. Like I did kind of the first half of it. And then due to personal leave, she kind of took over this case at that point.
Okay.
So after the hospital and removal, it's been more of investigator Stovall.
Okay. So before you went to the hospital with the family, did you ask the family of any other family members that they had or other support that they had in the area?
I did get collaterals from the family during my initial assessment. And I know that there was a caregiver resource form filled out during removal as well, and they provided caregivers. And so I did help contact those people as well as a possible safety monitor in case the court ruled that the baby ultimately placed back in the home with a monitor.
Okay. And so who all did you contact and what searches were done by the department?
So personally, I contacted, give me 1 second, Andrea Peterson and Vaughn Peterson.
Okay.
Which are going to be paternal grandparents. And then investigator Stovall contacted a cousin. I don't remember her name. And then Tatiana's, or Miss Acricia's sister.
And what were the results of all of that contact? Were you guys able to locate a safety monitor?
To my knowledge, I don't believe so. I know the Petersons were not able to do anything long term. And as well as the cousin, I don't believe she's able to do anything long term. All of them are based out of state as well. There was no one local the family had. And then I'm not sure if I don't recall I didn't have the conversation with the sister, nor was I present for that phone conversation. So I don't know what the result of that one was.
Okay. Okay. And what else did you do for your portion of the investigation?
I believe that's everything that I've done working with this family.
Okay. Your Honor, I pass the witness.
All right, thank you, Mrs. Whittington.
Hey, Judge. Ms. Wagner, I'm sure you've heard many times today, I'm Mary Whittington. I represent the parents. Ms. Wagner, when you met the parents on April 21st, you said you went to their house. Is that right?
Yes, ma'am.
And did you do a walkthrough of their home?
Yes, ma'am.
And did you find any concerns in the home?
I'm sorry, can you repeat that? I didn't hear you.
Were there any safety concerns in the home?
No, ma'am.
When you spoke to the parents about having a second opinion for Sophia, did you have a court order for that?
At the initial visit?
For the appointment with Ellison Palmer?
No, ma'am. That was just a directive that was given to me.
Okay. But you didn't need a court order to convince these parents to go to the doctor, did you?
To comply to go see Miss Palmer, no ma'am, there was not a court order.
And were you at the clinic during that evaluation of Sophia?
I was not inside the clinic. I waited outside.
Okay. And what did Miss Palmer tell you about the parents?
She said she had no concerns of abuse or neglect by the parents. She felt like they needed some education, that an ECI referral would be beneficial, and that she had prescribed them a high calorie formula.
You mentioned you talked to Andrea Peterson and Vaughn Peterson. Is that right?
Yes, ma'am.
And did you ask the Petersons if they would be able to monitor these parents for a year?
I spoke to them and said that typically with conservatorship cases, it's a long-term thing. I didn't ask them if they could do it for a year. I said it was on a long-term basis that could be up to 12 to 18 months, because typically that's how long conservatorship cases last.
Now, did you offer any education to these parents?
Did I? No, ma'am.
What type of education do you think they need, if any?
I mean, they would benefit from parenting classes.
Pass the witness, Judge.
Sorry?
I pass the witness.
Okay, thank you. Ms. Lucero.
Okay, thank you. Ms. Wagner, I'm not sure exactly how the process goes from y'all's end, but did y'all ever offer, I know y'all looked at alternate placement or backup help, but did y'all ever offer them like FBSS services, that type of, instead of going to the extreme that we're at now?
So that I did discuss, let me back up. In my initial visit, we discussed just getting them to the doctor and the recommendations of the doctor, of their first doctor, Carolyn McBride, and then the recommendations of Dr. Hansen. And then getting them to the hospital for that. And then anything further after that, further decisions on that case, I was no longer involved due to my personal leave.
Okay. All right, then. So according to your affidavit, the department, I guess, got a report back on April the 17th. Is that right? On or about the 17th of April?
The initial report coming in?
Yes. Uh-huh.
Yes, ma'am.
Okay. And then you stated, I guess, approximately, you reached out you attempted to reach out to the family on the 20th, I guess, 3 days later, but you weren't able to reach them. Is that right?
That would be Investigator Stovall attempted to make that initial contact. Okay. And then I assisted on the case due to being in the area on April 21st, and that's when I made contact.
Okay. Do you remember, and there's a reason I'm asking this, do you remember about what time you made contact with the parents on the 21st?
I don't.
Okay, well, you stated earlier.
Mid-afternoon.
Mid-afternoon. Okay. All right, then. When was the first time you made contact with Dr. Hansen?
So that contact was made by phone between my supervisor and Dr. Hansen. It was before 5 p.m. at that point that they had made contact. I couldn't tell you the exact time because I was not, I don't have that information.
Okay. So on that day, while you were dealing with meeting up with the parents, then I guess your supervisor was in contact with Dr. Hansen. Is that right?
That is correct.
Okay. And on the 21st, it was when the parents made that's when they went in to see Miss Palmer, right?
Yes, ma'am.
Okay. And so so at the time that your supervisor was talking to Dr. Hansen and giving her the the information, Dr. Hansen at that time still, is it your understanding she still didn't have the information from Dr. Palmer or Miss Palmer, if that's where the parents were at the time? Does that make sense?
She had the information. She had the information of the initial report and an image of the baby.
Okay, but she did. So I know she testified earlier about records that she saw, but she hadn't seen any records. She hadn't seen any recommendations from Dr. McBride or Miss McBride or Miss Palmer yet. Is that correct?
I don't know. To my knowledge, I don't know.
Okay.
I don't know what she had.
Okay. Well, you stated that there was a three-way. I guess eventually there was a phone call with the mother and you and your supervisor, right?
Yes, ma'am.
Okay. And was that after the visit with Miss Palmer?
Yes, ma'am.
Okay. At that point, had you spoken directly at any time with Dr. Hansen to let her know what Miss Palmer had said?
I had not spoken with Dr. Hansen. No, ma'am.
Okay.
I could not testify if that information was provided by my supervisor, because at that point, my supervisor did have that information because it was relayed to her by me.
Okay. All right. And so at this point, when y'all are making contact, your supervisor's making contact with Dr. Hansen, the child had already been seen by, I don't know if it's doctor, but Dr. or Miss McBride, that didn't recommend hospitalization, right? Ms. McBride didn't recommend hospitalization, isn't that correct?
Not that I'm aware of.
Okay. And then they went to go see Miss Palmer without a court order. They voluntarily went over there and there was no recommendation for hospitalization, right?
No, ma'am.
Okay. All right. And again, if you weren't part of the conversation, you don't know if Dr. Hansen at that point knew whether or not the child was gaining weight on this goat milk. Did she? Or do you know?
I couldn't answer that.
Okay. And then then y'all filed for an order to aid I guess for medical care or whatever that I might be saying that incorrectly. When did what y'all requested that on the 22nd or when? I haven't seen that is why I'm asking.
The order to aid was requested the following day and signed by Judge Graham the following day, that afternoon.
That afternoon. Okay. Okay. And then you heard, I guess the social worker from the hospital testify earlier today. She said that she received a call from the department. I believe it was from you, and it may not, but someone from the department stating that a child will be brought in to be for an examination. Is that right?
That is what Veronica Prosser testified. Yes, ma'am.
Okay. All right. Okay. And at this time, do you know who contacted Ms. Prosser?
I do not.
Okay. So you don't know if someone was contacted before or after Judge Graham signed that order, right?
It was, I believe it was after. I don't know what time it was.
But you weren't involved at that point, right?
I did not make that phone call, no, ma'am.
And as far as any backup caregivers or someone to supervise the family, again, is it your understanding that they really don't have any family members here in the area that could assist?
That is correct.
Before y'all reached out to Dr. Hansen to see if something else was needed, again, just to be clear, the FBSS services weren't offered to these parents, right?
At the time of the phone call to Dr. Hansen?
Yes.
FBSS had not been discussed at that point. No, ma'am.
What about a possible order to participate to help alleviate concerns, give the parents education, keep the department keep their eyes on them? Was that ever discussed?
In my part of the case, no. The only order that was discussed was that order to aid. Again, anything after that I did not partake in anything.
And I understand you don't partake in it. You didn't partake in it. I know that y'all kind of had the first part of the investigation. Ms. Stovall had the second part, but you have access to the records and what's going on with the case. You've had a chance to review things before you're here today. Is that right?
Yes, ma'am.
Okay. All right then. So anywhere in there, did you see where FBSS services were offered or possibly even an order to participate in this case?
No, ma'am.
Okay. I'll pass the witness.
All right. Anyone have further questions for this witness?
Your Honor, I do have a quick question, and I do want to let the court know that I called the wrong Haley. But Ms. Wagner, in regards to FBSS, you were asked if this was done as a reasonable effort. Would services have been enough to address the concern of the child's health and safety on the 21st or the 22nd?
Your Honor, I'm going to object to speculation.
Your Honor, she opened the door.
Yeah, I'll overrule it, but we can kind of short circuit this. FBSS would not have been considered by the court because Dr. Hansen was telling me this child was at risk of death. So it's that simple.
Okay. Thank you, Your Honor. That's all I had.
Okay. Anyone else?
No questions.
Okay. All right, then, Ms. Ferguson, other witnesses?
Haley Stovall, Your Honor.
Okay. Ms. Stovall, you unmute. Thank you, ma'am.
Yes,
if you
sir.
raise your right hand, you swear the testimony you give will be the truth, the whole truth, and nothing but the truth.
Yes, Your Honor.
All right, thank you. Ms. Ferguson.
Thank you, Your Honor. Ms. Stovall, please state and spell your name.
It's Haley Stovall, H-A-L-E-I-G-H, then Stovall, S-T-O-V-A-L-L.
Ms. Stovall, you've heard the testimony of Ms. Wagner, so let's pick it up where Ms. Wagner left it off. What is the thing that after Sophia was in the hospital, did you come back as assigned on this case?
So, yes, I was directed to assist in the exigent removal of Sophia.
Okay. While she was in the hospital, did you contact the hospital or gather any information from the hospital?
No, I personally didn't know. I know communication was had with my supervisor from the hospital, but not me directly.
Okay, so your supervisor was gathering all that information.
Yeah.
Do you recall what the department received as information?
I do not, I'm sorry.
Did you write an affidavit?
Yes, I did.
Okay, so what was the information in your affidavit that the department was concerned about during the hospitalization?
It was the lack of cooperation from Mr. Quickle, or the family to do the feeding tube, the non-complying on the feedings for the 30 minutes, stuff like that.
And did you believe that that Sophia would be in immediate danger if she went home with her parents when discharged from the hospital?
Yes.
And why?
There was a fear that the medical requirements or recommendations would not be followed due to the lack of compliance in the hospital.
And so at that point, is that why the department didn't consider services on the day that she was removed?
Yes, because Dr. Hansen, it was detrimental to the baby's health and safety.
And the concern was if she returned to the same environment she was in prior to going to the hospital, that would be dangerous to her health and safety. Is that correct?
Yes, ma'am.
Okay. And was it the department's intention when filing for removal that this family would be offered services?
Yes.
And do you personally offer families services during the investigation?
During the investigation, yes, but during removals, no.
Okay, so during the investigation, when you offer services, it's to transfer it to family-based safety services, is that correct?
Yes.
So you don't set up any services, is that correct?
Yes, ma'am. That's not correct.
Okay.
I do not.
And that is why we're here today. Is that your understanding, to ask the court to continue temporary managing conservatorship for this child and to offer order services for this family?
Yes, ma'am.
Okay. Let's talk about after the removal. What did you gather names of family members who could potentially be either safety monitors or move into the home so the child could be placed back home?
Yes, I did.
And
I gathered.
who were? Okay,
Oh,
go
sorry.
ahead.
I'm sorry. No, go ahead. I'm sorry.
No. Who were the family members you looked into?
So it was the grandparents, and it was Vaughn, and I'm trying to remember the grandma's name, not coming to my head right now. And then an aunt on dad's side and a sister on mom's side.
And did you run background checks on all of those people, or attempts to?
Yes, I did.
And what attempts did you make regarding background checks on people from other states?
So we had to do out of state background checks, and then we also spoke to them directly.
Okay, and who did you speak to?
I personally spoke to the aunt on dad's side and the mom's sister.
Okay, and would either of those been willing to come to Texas to stay with the family?
They were willing to come to Texas to stay, but not long term. It was for a couple weeks at a time. They obviously have lives and they are out of state.
Sure. Did the parents provide any other names of potential people who could be safety monitors?
The parents did not. When I spoke to the aunt on dad's side, she did say that she was talking to other family members, but I never heard anything back from that to this date.
And did you leave your phone number with her and ask her to contact you if she came up with anybody?
Yes, she asked for my first name and my last name and my direct phone number.
Okay, and you haven't received any phone calls?
No, ma'am.
Okay. Since the removal, have the parents been offered visitation?
Yes, they have.
And do you know when that visitation has occurred, roughly off the top of your head?
So far, it's been every Friday. Time frame, I don't know exactly, but from the pattern that I've gathered, it's every Friday.
Okay. Have you been provided with any names or numbers to run a home study for the child to potentially be placed with?
In the state of Texas? No.
Okay. And what about out of the state of Texas? Have the parents asked you to place the child with a relative?
They have not personally asked. All of the family members that we contacted, they did say that they would be willing to have relocation.
Okay. And that would require in order to do a home study in a different state, that would require an ICPC, is that correct?
Yes, it's quite a lengthy process.
Okay. And as you sit here today, though, you don't have anybody that the parents have asked you to run a home study on through an ICPC?
No, ma'am.
Okay. Have you had any interactions with these parents during your investigation?
I attempted to contact Tatiana about the caregiver form, but I was told that we weren't allowed to contact her and we had to do it through the attorney. So I did contact the attorney to get that sent over.
And was it Miss Akrish's request to you that you not contact her directly?
I don't recall that if it was her request or the attorney's request.
Okay.
But it was portrayed through her.
But you honored that, is that correct?
Yes, ma'am. Yeah.
But you did receive a caregiver resource form, is that correct?
Yes, by email. Mr.
Okay.
Quickle sent it to me.
Okay. Have you had a chance, well, since you haven't been able to talk to the parents directly, I'm assuming you haven't had any chance to talk to them about any types of services.
No, ma'am.
Okay. Have they asked any questions to you or anybody else with the department that you know of?
Not that I know of personally, no.
Okay. All right. Your Honor, at this time, I pass the witness.
Right, Ms. Whittington.
Thank you, Judge. Ms. Stovall, my name is Mary Whittington. As you know, I represent the parents. You and I have visited on the phone, correct?
Yes.
And I have copied you on several emails regarding these parents, correct?
Yes, ma'am.
And I've supplied you with their certificates for education and pictures of the baby, the house, all of those things, correct?
Yes, ma'am.
Okay. You testified that it would be a danger for Sophia to return to her parents after being discharged from the hospital. Explain what that danger is exactly.
I think the fear of going back to the lack of nutrition, not following the feeding schedules, not obeying's not the correct word that I'm looking for, but not following medical recommendations, maintaining the follow-up appointments.
Now, you said based on fear. Is the fear from the departments, is that a basis for not allowing a child to return to her parents?
I meant health. Fear was the incorrect word.
Okay. Now, you said that you were afraid that they were not going to follow the feeding schedules. Are you aware that the parents were already making gains of weight gains once the child was put on goat milk?
The department was informed of that, yes, during the hospital visit.
And even though the parents had made gains with this child's weight prior to CPS intervention, you're saying that they wouldn't continue making those gains? Is that what you're saying?
There was concerns of that, yes.
What evidence would you have that the parents wouldn't continue to feed this baby based on the recommendations of the medical providers?
Your Honor, I'm going to object to the request of evidence from a witness.
Whole rule. I mean, I know what I heard about what they were doing with the baby in the hospital, so.
There was already failure to follow through at the hospital. They weren't following the instructions of the feeding
Your Honor,
times.
that would be hearsay.
Sustained. I know what I heard earlier.
Thank you, Judge. Okay. Ms. Stovall, even though, when did you hear about Allison Palmer's assessment of the parents?
And I read about it in the investigation from Haley Wagner when I took back over.
Okay. So you're aware this was the second opinion that the department requested?
Yes, ma'am.
Right. And this biased medical provider found no issue with these parents. Is that your understanding?
That's what they testified, yes.
And did she communicate to the department that this parents need education for feeding?
Yes, that was communicated.
And are you aware if the parents received education while Sophia was in the hospital?
While she was in the hospital? Like through hospital staff?
Yes.
Yes, through testimony today, yes.
And you added some of that in your affidavit, correct?
Yes.
So even though you were aware of the assessment of these medical providers and you were aware that these parents had proper gains by following instructions from Carolyn McBride, you still feel like the baby's in danger with these parents?
I feel like the parents lack education to ensure that Sophia progresses.
Did you hear the testimony today from Maddie Ortiz saying that she observed these parents feeding the baby? Did you hear that testimony?
Yes, I did hear that
And,
testimony. Yes, ma'am.
and did you hear her say that she didn't have any issues or concerns with the way they were feeding the baby as far as the bottle usage or holding the baby?
That is what she testified. Yes, ma'am.
And that was part of your affidavit as well, wasn't it?
Yes, ma'am.
And in spite of all of that, the department still had concerns about these parents. Is that correct?
Yes, ma'am.
I pass the witness, Judge.
All right, Ms. Lucero?
Thank you, Your Honor. Ms. Stovall, at this time, is the department concerned that the parents won't follow any type of medical advice if the child is placed back with them?
I think with court involvement and the department's involvement, I think that alleviates the concern.
And would that be the same for following the feeding schedule and weight checks?
Can you repeat the question? I apologize.
No, you're fine. You're fine. Would your concerns also be alleviated regarding like the child's feeding schedule and weight check-ins if there was some type of court involvement?
Yes, if the family was being monitored, yes.
Okay. So at this time, is the department opposed to the child being placed back with the parents so long as the department is involved in some way to ensure that the child's gaining the proper weight, there's weight check-ins, and if there's any medical follow-up that needs to be done, that it will be done?
I think that's the court's call. I would heavily suggest a monitor being present and active in the home.
Okay, so you're saying you want the department's position at this point is that y'all still want someone in the home, right?
To monitor, to ensure that they're doing the follow-ups and following through with medical recommendations.
Okay, but if the parents, let's say the department was involved in some way and they're unable to have someone in the home, wouldn't weekly check-in weights with either Dr. Palmer or Ms. McBride, wouldn't that help alleviate those concerns if the child continues to gain weight, as long as she's checking in every week?
I would prefer to leave that decision up to Judge Graham.
No, I understand that. And he's going to have the final decision. I'm just asking, would that help alleviate the department's concerns?
Help alleviate, yes.
Okay, all right.
I want to correct one thing because I've heard it a couple of times, Miss Lucero.
I'm
There
sorry.
is no Dr. Palmer.
Oh,
Allison
okay.
Palmer is not a doctor.
You know what, Your Honor, I didn't want to be disrespectful, so I was trying to say Miss or Doctor, so Miss Palmer. Okay, thank you. I'll pass the witness.
Okay. Anyone else have further questions for Ms. Stovall?
Your Honor, just to clear something up.
Okay.
Ms. Stovall, is the department's position that we are asking the court to continue temporary managing conservatorship?
Yes, ma'am.
And is it the department's position that that is necessary to continue to ensure the safety of the child?
Yes, ma'am.
And as far as the child going home to the parents, is the department asking this court to order services for the parents to work prior to the child being reunified into their home?
Prior, yes.
Okay, thank you. Your Honor, I pass the witness.
Anyone else?
Your Honor, I have a follow-up. Ms. Stovall, what services besides parenting are y'all requesting for the parents to participate in?
Parenting classes. I mean, I don't exactly know.
Well, Haley, I'll help you out here. You've already
Okay.
testified. It's not your job to set up the services. Your job's to investigate, and then it goes where it goes. Correct?
Yes, sir. Thank you.
That's all I have, Your Honor.
Okay. I'm going to ask you a question that I know you can't answer, but just to be sure, are you don't deal with the services, but are you aware of any type of quote education or service I can order to teach these parents how to feed their child? I've been asking everybody that. I haven't heard anything yet.
Not to my knowledge.
Okay.
I wish I had an answer for you.
I wish you did too, because I certainly don't have one. Okay. All right then. Any further witnesses, Ms. Ferguson?
No, Your Honor. And at this time, the department rests.
Okay. All right. Then Ms. Whittington, witnesses?
I just want to briefly call mom just to clear up something, Judge.
Okay. I need to take about a 2-minute break and make a phone call real quick, and I will be right back, I promise.
Thank you.
You may proceed.
Thank you. Ms. Akrish, there's been some questions asked today regarding follow-up appointments with Sophia. Did you hear all of that testimony today?
Yes, I did.
And your husband was talking about a death in the family. Can you explain to the court what that was?
Yeah, my brother-in-law, that's my sister's husband, passed away on February 14th, which is Valentine's Day. And he was sick with ALS. And that was a very sad situation happening, an event happening in our family.
And so when he passed away, did you and Sophia go to see your sister?
Yeah.
And where does she live?
In Wisconsin and Mineral Point.
Okay. And how long were you gone?
From February 25th till March 31st.
Okay. So
A little over 5 weeks, 4 weeks.
when you came back, is that when you made an appointment to see the doctor?
Yeah, and I was also trying to reach the breastfeeding consultant in Ukraine, which I contacted earlier when only Sophia was born. And she gave me consultation, how to breastfeed and all the details about that.
And you went to see Carolyn McBride. We've talked about extensively today. And on the 14th, did she prescribe a new formula for you?
Yeah, and I was asking her if goat milk formula is going to be fine, and she gave us like a few examples of it. And we chose Cabrita to be one of that we can feed the baby. We checked if it was available in the market in Delhart. It wasn't available, and I ordered it online. And I chose Walmart to order because it was delivered like next day.
Very good. And when you received that formula the next day, is that when you got started on the Cabrita?
Yeah, as soon as we received it.
Good stuff.
And also during this time, are you the one that ordered the baby scale?
Scott ordered the scale.
Scott did. Okay, very good. And so I think there's some concerns, or at least it's been testified to today, about your ability to feed the baby. Can you explain what you were doing to feed the baby on the Cabrita, where she was making that positive weight gain?
Well, with Cabrita, we were trying to see, to measure exact amount she should eat per time. With the breastfeeding, it's hard to do because you never know how much she ate. So it should be measured. Her feeding should be measured. If it's a breast milk, it's better to pump it, to put it in the bottle, and then we can see how much she ate. So when it's measurable, it's easier to see that she's getting as much as she needs.
Have you learned a lot through this process?
Oh, yes. A lot. And while we were at the hospital and communicating with the breast consultant and with other specialists and with Karen McBride and with Jamie Martin when I came for my appointment. So, yeah.
And if the judge were to order that Sophia is placed back with you today, how will you go about making sure that she's fed appropriately?
Well, we're definitely going to follow a doctor's recommendation because
You're frozen.
that amount she's eating will be changed.
Okay, excuse me, ma'am. You'll have to repeat your answer because y'all froze up again.
Sorry.
So one more time, if you will, Ms. Krish, will you describe to the court how you will ensure that Sophia is fed appropriately?
Well, at the hospital in Amarillo, it was 4 ounces she was eating. Afterwards, I know that that amount per feeding increased and it was 6 ounces. And since she is gaining more weight, it means the amount will increase. So we have to talk with the doctor, and the doctor is going to tell us how much it should be per feeding, and we're going to follow. I mean, as soon as it should be measured, we see how much she needs, we give that amount to her as many times as needed during the day. If it's formula, it should be mixed like the doctor says us to mix it. And if it's breast milk, I can pump it and I can see the amount that is pumped.
Okay. And have you requested the baby's current feeding schedule? Have you requested that information?
Yeah.
Did we?
And have you received it yet?
Not yet.
No.
Okay.
That's good. Fine.
Now, Ms. Akrish, you and your husband have taken some classes online through WIC. Did you learn any good information from those classes?
Well, yeah, there was certain milestones we're looking for, and since she is getting 6 months old, it's good time when she can start solids, and their course was telling how to start, that it's better to go with the vegetables first, that it should be pureed, but still main nutrition for her is going to remain breast milk or formula. And all the rest is going to be like additional.
Okay. And do you feel like you have a pretty good grasp based on the education that you received at the hospital and then even on your own with the Cabrita? Do you feel like you have a good grasp on feeding Sophia at this point?
Well, I believed I learned a lot, which should be followed, and I'm going to follow it. As she is gaining weight, she is doing much better. So, yeah, I would like to follow those recommendations.
Are you asking Judge Graham to return your baby home?
Of course.
Are you willing to follow any safety plan or even order to participate that the court may have for you and your husband?
Yes.
Yeah.
I pass the witness, Judge.
All right. Ms. Ferguson, questions? You're muted.
Your Honor, ordinarily I would have questions, but for the sake of the time, I'm just going to pass the witness.
All right, thank you. Ms. Lucero.
Hi, John. I don't have any questions. Ms. Whittington covered what I was going to ask.
All right. Okay, then, Ms. Whittington, do you have any other witnesses?
I do not, Judge. I rest. Thank you.
All right, thank you. Ms. Lucero, witnesses?
No witnesses, Your Honor.
All right, Ms. Lucero, recommendations?
Your Honor, it's kind of like an alternative, but I don't know if it's possible. I would ask the court maybe to order to participate in this case and place the child back with the parents, and then have the weekly weigh-ins any lab work or anything like that that's required that the parents follow, and for them to follow the feeding schedule, and any other orders that the court thinks is appropriate. In the alternative, Your Honor, if the court is not, doesn't believe an order to participate is sufficient, then I would ask if the department's named temporary managing conservator, Your Honor, I would still ask for the child to be placed back with the parents with the same recommendations as far as weekly weigh-ins, any lab work, medical advice, and a feeding schedule, Your Honor.
All right, thank you. All right, Ms. Wyatt, recommendations from CASA.
Yes, Your Honor. CASA will recommend that the department be named temporary managing conservator, but that the child be placed back home on a monitored return with weekly weight check-ins, and that information be provided to all parties, including CASA, and that the family and the parents follow any and all recommendations from the doctor. I would recommend that the parents be provided the feeding schedule and routine from the current foster placement. And as far as education, I'm kind of on the page with you. I'm not sure where that education comes from, but I would recommend that the parents continue what they're doing with WIC, and if anybody else has any other resources, that the family do that. I would recommend that the ECI, it sounds like ECI evaluation has been started, but that make sure that that continues with the parents. And then also just to let the court know that I have spoke to our CASA volunteer, and she lives in Stratford, and she said she could be in the home weekly. If the child's on a monitor return, then St. Francis could be in the home weekly. And then with weekly check-ins, that could be potentially 3 days a week that different sets of eyes are on that baby.
Great. That sounds wonderful. Okay, give me just a second here. Ms. Wyatt hit it right on the head. It's just going to take me a minute to get that all on paper. I should have just had her announce it. Give me just a few minutes here. All right. Based on the evidence I've heard today, as well as the exhibits that have been admitted, first of all, I will deny the parent's motion to dismiss the case. I will continue the department as temporary managing conservator. I will order that Sophia be placed back with her parents once they've been provided with a feeding schedule that is approved by the child's physician or physicians. And what I mean by that is not a nurse, practitioner, the actual physician or physicians. Then I will order the parents to strictly follow that feeding schedule that will be provided to them. The child will not be returned until they have that in place. I'm going to order the parents to present the child for all medical appointments and or procedures as recommended by the child's medical providers. I will order weekly or more often weight checks for Sophia, more often if recommended by Sophia's medical providers, but at least weekly. And that, as Ms. White said, that the department is to make all of the parties, including CASA, aware of those weekly checks, or the results of those weekly checks, I should say. I'll order, if it's not already taking place, I'll order that Sophia undergo an ECI evaluation and follow all recommendations of that evaluation. Let's see. I don't think I have anything else. I want Miss Whittington, if you'd be sure your clients understand legally and procedurally, the department is the temporary managing conservator. The department makes the medical decisions for the child, not the parents. Even though the parents are going to have the child in their home, they must follow whatever's recommended by the conservator, which at this point is the department. So,
Yes, sir.
okay. Unless somebody knows something I've missed, I'll set a status hearing in this case for June 17th, 2026. That will be by Zoom like today's hearing. Parties can ask their lawyers, or anyone can go on the court's online docket a day or two before June 17th to see what time of day we'll have that hearing. That will avoid you having to sit in the waiting room for hours waiting for us to get to you. So, does anybody have any questions or anything I've missed?
I have a comment, Judge, if you don't mind.
Sure.
Dr. Hansen did testify today that she observed Sophia last week and that she did make a modification to the baby's feeding schedule. So just a note for the department that Dr. Hansen should have something already available, because she said she testified that she did tell them to add a little more formula than what the can called for on the Nutramigen. So she should already have something documented from a doctor.
That's good, and I trust her implicitly, but I want it approved by Sophia's physicians, and she's not Sophia's physician. So I'm happy for Dr. Hansen to present it to Sophia's physician, and if that physician says, yeah, I agree in total, then that's what the court has ordered, because Dr. Hansen's going to be out of this. So we've got to have somebody that's going to make those calls.
Gotcha. Thank you for that clarification.
Okay, if there's nothing else, then we will stand in recess. Y'all have a good weekend, and we'll see you back on June 17th unless something comes up earlier.
Okay, thank you.
Thank you, Judge.
Y'all.
Thank you, Judge.
Yes, ma'am. Thank you, Nori. I appreciate you hanging in there with us.